Sheba Medical Center, named by Newsweek as one of the top 10 hospitals in the world, is Israel's foremost hospital, the largest medical center in the Middle East, and a leader in international technological innovation and cutting-edge research.
So a couple of years ago, we've decided to build ARC, our innovation program, global innovation program, which has one aim: to change healthcare by the year 2030. Sheba is looking for global impact. How can we improve healthcare around the world?
I'm standing on the 12.5-acre parcel of land that Jersey City, through the visionary leadership of Mayor Stephen Fulop, donated to Liberty Science Center for SciTech City, where innovators, scientists, engineers, and students will come together to harness science and create a better future for all of us.
This is where it all needs to begin. Our project here at Liberty Science Center is build a living lab, a lab where we can actually play and work to test out everything we're developing around the world, the best that's coming out of ARC, the best that's coming out of Israel.
This project is going to take place closer to Lower Manhattan than the Upper West Side is. So there's going to be access to the capital, the companies, and the innovators, private equity firms, and others in Lower Manhattan.
It's an amazing opportunity to accelerate the speed at which we take new technologies and we move them from the brains of the entrepreneurs, work in a simulated environment of the future where they can fail quickly and test quickly and learn with the speed of iteration being very fast. So you get to the final result and into actual hands of caregivers and patients.
In Jersey City and Hudson County, health equity is a major problem. So this project is particularly going to help people that don't have easy access or affordable access to health care.
We're excited about bringing Israeli technology and innovation to partner with New Jersey industry, New Jersey hospitals, to transform healthcare for our backyard, New Jersey's communities, and the neighborhoods surrounding Liberty Science Center.
We're looking at our connection with Sheba as one of our best investments in the future of Israel, in the future of health in the whole world.
Between New Jersey and Israel, this would be one more that would amplify the technology that came out of Israel and hopefully have an impact, positive impact here in New Jersey communities.
We do worry a lot about how Israel is perceived and how that affects the Jewish community here and abroad. One of the most important ways that we can benefit Israel and our Jewish community is by demonstrating the value of working together, the value of what Israel can bring to our society and what we can gain by working with Israel.
When you look forward 10 years and 20 years and 30 years, this is a moment that will change Jersey City forever.
This would be where the future of healthcare begins.
Welcome. Thank you for making time and joining us today. My name is Brian Abrahams. I am CEO of the American Friends of Sheba Medical Center. And on behalf of everyone who's speaking today, we'd like to thank you all for joining us. I'm particularly grateful to the representatives from the medical centers who are here, RWJ Barnabas, Hackensack Meridian, Valley Health, Holy Name, and the delegation from Jefferson. I also want to welcome the many people who are watching on Zoom, including current and future healthcare partners in Florida and around the U.S., as well as a whole bunch of folks in Israel are watching us. So I want to get right to the program because there's so much intellectual firepower, scientific and medical experience on this program. Not since Maimonides dined alone has there been this much intellectual firepower in one spot. So I'm going to begin by introducing our host here today. Paul Hoffman is the president and CEO of the Liberty Science Center, where we now sit. Not noted in his bio, today is his birthday, so try to be kind. As a journalist and biographer, Paul's extensive body of work explores the relationship between genius, madness, obsession, and creativity. He's the author of 11 books, most recently a memoir about the world of championship chess called King's Gambit, a son, a father, and the world's most dangerous game. He was the longtime president and editor-in-chief of Discover magazine, the president and publisher of Encyclopedia Britannica, and most recently the editorial chairman of the video interview website Big Think. He is a noted expert on the public understanding of science and has advised NASA, the National Science Foundation, among many others. Paul was elected to the American Academy of Arts and Sciences, graduated summa cum laude and Phi Beta Kappa from Harvard. As a television personality, he has performed wacky mathematical paper tricks on The Letterman Show, The Oprah Winfrey Show, where he was the solo guest for the entire show. He's also played chess with Gary Kasparov and was taken into custody in Libya when he tried to play chess with the late Muammar Gaddafi. Please welcome to the podium the birthday boy, Paul Hoffman.
Thank you. Maybe later after a few drinks and everybody, I'll tell you more about trying to meet Gaddafi, but that's not appropriate for today. Thank you so much, Brian. Really, I don't need to tell you where Liberty Science Center is because all of you made it here. But as you can see, we have this glorious view out the window of the Manhattan skyline, and there the Statue of Liberty. And to me, the Statue of Liberty and Ellis Island right next to it represents many things. Of course, it represents people crossing borders to set out on a new life here in the United States. But to me, it also represents ideas crossing borders. And is nowhere in the world is that more important than in the fields of science and medicine, right? Because a medical discovery or a scientific discovery that could help all of us could come from anywhere in the world. It's the fact that the Chinese sequenced the COVID virus and published that publicly that really accelerated the vaccine efforts, right? But for breast cancer, it could be discovered in Germany, it could be discovered in New Jersey, it could be discovered in Israel. So I think symbolically, this is a really great place for us to all work together. And we're delighted that Sheba is our chief innovation partner in the healthcare innovation space at SciTech City. So let me just tell you a few things about Liberty Science Center. We're a large cultural institution in New Jersey, both by size in terms of our attendance. We had an attendance before COVID of about 750,000 visitors per year. We're going to surpass that this year. People are back in force. People were tired of not getting together with folks. And as you can see today, if you were out on the floors, I mean, this is a school day, so people aren't even, it's not a family attendance. It's people related to school, and it's very crowded here. And over the next 2 weeks on the school vacation, it'll be incredibly crowded. So we do a lot of programs that you don't see when you're out there in the exhibition hall. So we work with about 290,000 K through 12 students that physically come to this center annually, not just for the run of the place, they do that, but for hands-on inquiry-based lab experiences, including robotics programs that we'll do for children as young as 5 years old, but very sophisticated programs for, say, high school kids. We have a unique program that was launched here called Live from Surgery, where we connect you to the surgical rooms in 6 different hospitals, where you watch an entire surgical procedure from the beginning to end while conversing in real time through video conferencing with the surgeon and his or her team. That's transformative. I, frankly, before I got this job 12 years ago, had never seen an entire surgery. It was eye-opening to me, but it was particularly eye-opening to these kids. And what we do there is introduce everybody to all the professions that are represented in the room. We have had students that have gone on to become surgeons because they've seen that program, but let's face it, that takes a lot of training and time. But there are ancillary jobs there, including often a radiology technician that more often than not doesn't have a college degree, but instead went to a certificate program. And we'll be working with kids from a community here, maybe an underserved community, where many of these children's parents are unemployed. These are high school kids, and they realize if they stuck it out in high school, they could go into one of these training programs. And by the way, we have a shortage of people going into those jobs in New Jersey. So that's what we try to do. With young kids, it's keep that scientific curiosity alive that every child is born with, that for some reason in our society all too often gets snuffed out. We try to keep that alive. But as the children get older, entering junior high school and high school, is really to introduce them to possible STEM careers and what they could do. And it could be being, a scientist, but it could also be, as Jamie Dimon, as you'll know, runs JP Morgan, likes to say, that JP Morgan's the largest technology company in the world. because I think they employ 45,000 programmers. So every company now is a STEM company. So that's what we try to do in general. We're a large institution in terms of our impact. We work with 2,935 schools over the last 3 years. So we have a whole team of science educators that are doing that. More numbers, but I won't go into those in detail. But the 290,000 students that come here are just the ones that are physically here. Of course, all our programs during COVID morphed to be delivered virtually. And we did a unique thing there. There's lots of good science programming. You can look at it on the Discovery Channel, National Geographic. Ours were all interactive, moderated by an educator and two-way, where you can ask questions of the educator, where you're doing experiments in your home. Even if it's broadcast from our planetarium, you could go out that evening with your parents or caretaker and look at the night sky and some of the stuff. And that was what's unique about our programming. So we've done planetarium programs that reach 200,000 people on Facebook. So our impact is pretty large. We're very proud to have the largest planetarium in the Western Hemisphere. We have a series every month of some of the world's leading astronomers presenting their work and using this incredible canvas to show that. Many exhibits on contemporary science. So this is about making mammoths. Sounds like science fiction, but it's a real effort going out of Harvard. The genetics and genome leader, George Church, who can't be dismissed because he developed the techniques that led to the mapping of the human genome, is trying to alter between 20 and 40 genes in a modern elephant to make them into mammoths. There's ethical considerations that are raised by that, of course, but it's all based on CRISPR technology. So the point of the exhibit is to introduce you to that, which of course is transforming all aspects of medicine and biology. We're very proud that Sheba has been working with us to do what we call pop-up sciences on the floor of the museum. This was tied into an engineering week, and it was quite successful. Thermal imaging cameras that were right in the news at that moment because of the devastating earthquakes in Syria and Turkey, and of course being used to see if people were still alive. But this went over very well with our audience, and we'll be continuing to do that in the future. We really want to show off real science here. This is not a museum about science fiction. It's not a museum about yesteryear science. It's an interactive place too, which distinguishes it from many other cultural institutions that are advancing science. And we really believe that the best way to get involved in science is to actually do science. So we try to do that not just for our school groups, but for our adult visitors as well. Go back 1 second. So upcoming on May 22nd is our annual Genius Gala. It's Liberty Science Center's 30th anniversary, and this is sort of the must-attend event in the Northeast for people that are interested in really cutting-edge science and technology. We try to make heroes of singularly brilliant men and women of science, often representing a team that's done the work, since so much science now is not done by individuals. But our 3 honorees this year are John Mather. So he's the chief scientist for the James Webb Telescope, which of course you've all seen the astounding images that it's sending back, and it's just started. The thing that astronomers are very excited about are not the open questions that it's going to answer. They're excited about that too, but that it's probably going to find new objects in the cosmological zoo that astronomers have never even imagined that exist, and that will be incredible. He also, by the way, won a Nobel Prize in 2006 for the first real observational evidence that proved the Big Bang. How cool is that to be responsible for that? Dr. Uma Valetti, who I just spent last weekend with out in San Francisco. So there are 150 companies in the world that are trying to grow no-kill lab-grown meat. So this is not vegetarian substitutes for meat, like Impossible Meat. This is actually taking stem cells and growing meat. This was the first company to start and the first to get FDA approval. And they're all set with a gigantic factory there to do this. Whether or not this will work in the end, and by that I mean a lot needs to be done to figure out how to mass produce this so that it's not just a boutique item. But we all know that food and food production and food insecurity, and what are we going to do as the population develops and India and China has increased standard of living. First thing people usually spend money on when they have discretionary money is better food for their family, which means meat. We're going to have a crisis in this, and he's leading one possible solution to this. And then Cataline Carico, who spent 4.5 decades with nobody really paying attention to her, trying to understand messenger RNA, make synthetic RNA, so RNA in a lab, so that you could direct our protein factories to make a substance. Amazing story of her being sort of trapped in postdoc hell, not being able to get NSF funding to support getting a full professorship at the University of Pennsylvania, bouncing around to people's labs for 4.5 decades, and then she succeeded, and it's her patents and her work that both Moderna and Pfizer have used to make vaccines that you all know how many lives those have saved. It's this kind of thought leadership and this kind of this group of people that we bring here that we definitely want involved in SciTech City, where we'll be creating businesses. So we've honored Richard Branson, Jeff Bezos for what they've done in space, Craig Venter, who mapped the human genome, George Church, as I mentioned, who developed the techniques that did that. Last year, Robert Montgomery out of NYU, who did the first procedures of using a genetically engineered pig's kidney and transplanting it into a human. These are the kind of people that will be bringing in force at SciTech City. So SciTech City has 4 elements to it. Liberty Science Center, which exists. We're here. This will be a 30-acre campus with Liberty Science Center High School, a STEM-oriented high school for the entire county that we're in. It will be a public school. Scholars Village, there'll be residential housing. We want this to be a community. We want entrepreneurs to move in. They're scientists, STEM graduate students, families and individuals who want to be part of a community that embrace the idea that sort of the best way to predict the future is actually to invent it, right? Why wait for the future to passively happen when we can influence the course of events? And scientists are the world's biggest optimists, and they should be, right? It's optimism that's based on real work and understanding that we live in a world, I don't need to tell you this, where there's a lot of scary problems out there. Certainly science is a large part of getting out of some of these problems. I mean, if we're going to reverse climate change, science is key to that. Science, of course, is key to our future in healthcare and so many things. So we want a community that's infused with that spirit, that's very forward-looking in what science and technology can do. So here's where we are on this project. So Liberty Science Center's mission is very simple. It's to inspire the next generation of scientists and engineers and innovators. SciTech City has a broader mission that's an extension of that, and that's to empower world-changing entrepreneurs and scientists that have ideas that maybe could be commercialized and do great social good, but they need business resources. They need to be capitalized. They need people that have started companies before to guide them. That's what we're going to try to accomplish here. And at this point, we have $400 million committed to this project. We need 440, so we're very close. The strong alliance of major companies, Verizon, Bank of America, EY, ADP, and Horizon Blue Cross Blue Shield in New Jersey are founding partners. We've supported all levels of government, Jersey City, the Hudson County. Hudson County is floating bonds in a few months to build Liberty Science Center High School, and the state of New Jersey, and extensive private philanthropy to get there. So this project, we will start the construction in the summer and open this project in 2025. A little bit more just about where we are and sort of the elements of the project. It's EdgeWorks we'll talk about in a moment, because that's where Sheba is going to have the top floor and where the healthcare innovation activities are going to be centered. But you couldn't have a more centrally located location. You have ferries that run to Wall Street and Also right across the river here, we're next to a light rail stop that connects to the PATH train, so it's 35 minutes to Penn Station. It's about 15 minutes to get to the World Trade Center. Through an exit on the thruway here, and then of course we have the Statue of Liberty there for our symbolic part of it. By the way, we're making a very large activated public commons where we see things like farmers markets, concerts, health fairs, outdoor makers lab, constant activities there. The space is large. If you've been to Rockefeller Center in New York, it has the exact same square footage as the skating rink and all the public activities around it. That's a big part of this project, is we want this to be open to everybody and the community, and for it just to radiate innovation. So here's where we are on the construction. We've spent a year doing all the site work there, elevating some of the land. We had to rip out 3 acres of tanks that were buried there and do it in a way where we were constantly doing environmental testing to make sure there wasn't any cleanup. We finished the site work for Edgeworks and Scholars Village. There's a small environmental area on the school site that we just got EPA approval to clean up, and that will be cleaned up over the next 4 weeks. So that stage of the project is done. So there was this huge tank out there. No one knew what was in it. Rainwater could get in it, and we opened it, and there were over 90 goldfish in there. So being the benevolent institution that we are, they've been transported to tanks in the back. We will set up a tank there. One will be called Psi and one Tech when we have the project done. But actually, just one little story. When my team was doing this, a man came up who works there's a municipal utility pumping station right near it, and young man, he said, "Oh, my father tossed a fish in there like 20 years ago." Well, that explains this unique ecosystem, and how many didn't make it because the others ate them, I don't want to know, but it was thriving there. Whoops, sorry about that. Yeah, okay. So these are the fundamental premises behind SciTech City, that applied science can be used to tackle humanity's greatest challenges. That is very important to have young entrepreneurs and startups in developing these innovation solutions. I mean, the world, as you know, has totally changed. Companies, at their own peril, if they're only developing their next ideas within their walls. I mean, if the pharmaceutical industry can move out of that and has moved out of that, and they're, of course, concerned about IP, all companies need to do that, or you're going to end up like Kodak and Pan Am. So it's really important now to make sure that you're involved in the startup community, and that it's open innovation, and that crosses all borders, as I say, and that there's collaboration between government, the public sector, and the private sector. And certainly in healthcare, there are all sorts of players that are involved, right? I mean, it's not just putting out something that's going to work. How does it fit into the physician workflow stream? Who's going to pay for it? How are regulatory agencies going to react? It's much more complicated in the health space than it is in some other spaces. Even if you're a startup, you can't go on and do that. You need to work with a hospital. You need to work with a big player. And that's one of the things that we're going to be working with Sheba to bring together and create that ecosystem. So SciTech City initially is focusing on 2 areas, healthcare and planet care. And in each case, it will be creating a public, private, and academic innovation engine and using players from all those sectors. I'll tell you a little bit more about what that means. So there are 3 things that I think SciTech City can do. The first is in the thought leadership and community space of bringing together people. First of all, creating an on-campus community that also is a virtual community, but involves the best thinkers in the world, not just to think, but to do, to come out with actionable results, right? So part of it's building on what we do with our Genius Gala and having a whole series of Speaking of Genius talks. We do that now very well in astronomy in our planetarium, but to work with Sheba and other partners in doing that in the healthcare space, creating business roundtables. And so that's what we're going to do in the Reimagine space. And we are creating a 3-story conference center. There is no conference center in Jersey City, which will enable us to do this on a very large scale, both making it available to people that want to do new things and also working to try to get some of existing conferences to switch their locale to doing it at SciTech City. So we have a lot of space for that. The second element of what we can do is to really showcase products and solutions. We can do that in the conference center. We can do that here at Liberty Science Center. We have more than 20 million vehicles that pass our campus. So we really have an opportunity to showcase things to the world. We're in a great location, both physically and to attract people. We have large digital signboard on the side of SciTech City that we'll be able to use to show events and things that are going on in SciTech City. Largest urban park, I think, in the United States. It's 1,200 acres. It's larger than Central Park. But at the moment, 1,000 acres of it you can't go in because it hasn't been cleaned up. There finally is the funding and a beautiful plan. So all the park that you see outside the window over to the edge of the Hudson, you cannot go in that now. That's 268 acres. That's all being cleaned up, and there'll be trails that lead from here to the edge. So this is going to be incredible. SciTech City and Liberty Science Center, almost the hub of this park. So we're excited about that. So the whole campus can focus as a place for new product launches, product testing. My background, I was at Disney for 10 years, and I've been involved in different World's Fairs over the years, including, it's my birthday, and you can guess sort of how old I am, but I went to the 64 World's Fair, where AT&T premiered the video phone, and of course, that's what we all used during the pandemic, a form of that, Zoom, right? We want to be the place that exciting new products are introduced on a large scale. We want to do what a World's Fair does, which is usually known for just like 1 or 2 products, and to have that constantly happen here. So there'll be the business activity that takes place here, and then there'll be partners that come in, and I believe we can do that. I mean, we do that very well here at Liberty Science Center in our space that's more directed to children. SciTech City is more directed to adults, and I think the two will work synergistically. We're in the media capital of the world, so I think there's opportunities here to really become a place in the world that's known for the most important technology product introductions that could change the world. And that's our umbrella goal. And then the last thing is what we're going to be. So we're really going to create, a healthcare innovation engine to focus on technologies in particular that are going to help with the transformation of moving healthcare out of you're being treated in a hospital when you're seriously ill, which is I'm oversimplifying this, and many of you are in the medical profession, so I don't need to expound on this much, but not treating conditions where it's really late stage, as opposed to warding off those conditions perhaps entirely, or starting to treat you in a much earlier stage when the success rate is much greater, meaning doing it in people's homes and their community. There's so many things that need to be done to get there, but technology and wearable technology and bandwidth and all sorts of digital developments are going to be important there. And that's what we're going to be focusing on in terms of companies and startups that will be based at SciTech City, and giving them and getting them the resources that they need to try to be successful. So one of the things that we're doing, and I'll go to this slide on this. So we have put together, NSF issued a new grant proposal that's very important to the US federal government to create regional innovation engines trying to duplicate what happened in Massachusetts organically in terms of it becoming a life science cluster, trying to do this not just in health, but any applied science. And they put out an RFP where it could be $160 million over 10 years. We submitted SciTech City. We made the first round. 12 New Jersey institutions were invited to go to the second round. The other 11 were asked to go for a $1 million planning grant. We were asked to go for the full 9 yards. So we're in the process of that. Whether we get this or not, of course, it'd be wonderful if we got it. It would really accelerate what we could do. But we're going to do this anyway, put together this coalition. And we have strong academic partners, some in this room, like Thomas Jefferson, thank you. But we've put together partners like Princeton and NJIT and Stevens and NYU and Rowan Medical School. And there's 60,000 students among them. So one of the things we're going to do is student innovation challenges. When a company has a challenge, to put it out there to student and faculty, and that's going to be something that's going to go through our innovation engine. And also a venture studio where we have folks that have done this many times in terms of creating companies out of academic ideas when there's a really good idea out there, to put it through that. And also to build an accelerator for companies that are a little further advanced in what they're doing. And finally, the other thing we're doing from the beginning is 2 floors are going to be devoted to a SciTech Impact Hub. That's really to try to give the support to underrepresented groups in the STEM world, so minorities, women, and give them physical space and also all sorts of services that our partners can provide, whether it's banking services, whether it's payroll, whether it's legal, whether it's computer services, whether it's how to pitch to VCs, and do this on 2 floors. As much as Jersey City and New Jersey is thriving, there's a lot of people that are left behind here, and we'd like to make a difference in that space. So 2 of the floors are going to be devoted to that. So we really are excited about Sheba's role. I mean, there couldn't be a greater partner in the healthcare space. And I mean, you're a world leader in innovation. So on behalf of the state of New Jersey and Liberty Science Center, we're very happy that you're joining us at SciTech City. Thank you.
Has a passion for bringing together the fast-moving Silicon Valley mentality with the often tradition-bound academic healthcare system in a way that reduces costs and bridges the gaps of inequity and health disparities. He has been dean of 2 medical schools, a CEO of 3 health systems, and from 2013 to 2021 was president and CEO of Thomas Jefferson University and Jefferson Health, leading Jefferson to become one of the fastest-growing academic health centers in the country. Dr. Klasko is co-creator of the concept of health assurance and is currently working with General Catalyst and others to transform healthcare from its traditional focus on sick care to supporting people as they thrive. At Sheba Medical Center, he serves as North American Ambassador and Chief Strategy Officer for Global Growth and Health Policy. In 2020, the World Economic Forum named him a Distinguished Fellow for the Digital Economy. He has written or co-authored, I think, 7 books. If my number's right, the 7th is actually on the table in front of you. So I welcome to the podium Dr. Klasko.
Hi, I'm Steve Klasko, and I've had a hell of a morning. You know, time travel is really exhausting. I came back from the year 2032 to give you the good news. Thanks to this amazing conference, you have tackled one of the 2 major existential crises of your time, ensuring equitable health assurance for everyone, and I mean everyone on the planet. You did it. You know, today in 2032, I'm the Chief Digital Officer for President Taylor Swift. Yes, the Swifties became a political movement, and they swept the nation and the world. Our slogan? Tailor healthcare for each individual and make it swift. Pretty cool, huh? I might have written that for her, actually. The Digital Connectivity Act of 2024 was a huge start. It sent the message that everyone deserves access to health care at any address, including your home. It sent the message that we must close the divides in life expectancy that threatened our societies. And it ensured that the digital revolution would not just make the wealthy healthier. There was one really big insight here, and it's this. No one wakes up in the morning thinking or wanting to be a patient. What they want to do is be a person that can thrive and be happy without healthcare getting in the way. So we took that model to heart and we created true connected care at any address. But listen, none of this would have mattered if we hadn't made health equity our goal. That's why in 2021 we announced a major partnership with Novartis called Closing the Gap. We needed to understand exactly how preventable cardiovascular disease hit underserved neighborhoods so hard. By the way, we couldn't do that from sitting in my executive office in the hospital. So what we had to do was we built trust with people in those communities to tackle the issues of screening, diagnosis, care, and prevention. We took it to barbershops, hair salons, churches, community centers, homes. I was on a radio show every Sunday coming into people's living rooms. It worked. So, lessons learned? Trust matters. In fact, trust is so much more important than technology. We tend to get really excited about the shiny new objects. You have to start with trust. And ethics is in the beginning of that trust. Trust is central to every radical collaboration, and it's central to our relationship with the people we serve. I'm really delighted to join you today with this, what we call history of the future. The lesson learned is, as Steve Jobs taught us, always look for what will be obvious in 10 years from now, and just start doing it now. Every one of you at this meeting is part of this revolution. I'm really excited to join you. Oh, and I have one more surprise. I'm not really me. I'm a hologram of me coming to you from 2032 to assure that you got it right. So remember, be tailored and be swift. See you later. So I have one more story from 2032. For those of you who read my book in 2022, I've always been a DJ. So when I'm not the Chief Digital Officer for President Taylor Swift, I have my own store, Stevie's Vinyl Records and Implantable Brain Chips. You know, one of the things we found over the last several years, as neuroscience has progressed, people really understand things better through music. So I thought what I would do is actually really try to break your eardrums. Can you turn that down? Yeah. I thought what I would do is actually try to give you sort of that music version, because the concept of the book, it's a partnership with Spotify, is that everything I learned about being a healthcare leader for 30 years, I learned from being a DJ for 40 years. So I thought I would sort of give you the Sheba 2030 and where healthcare is going part based on 3 or 4 songs. But I think one of the lessons that gets lost a lot, because we're going to talk about all this optimistic stuff, is, you know, why have we not solved the broken, fragmented, expensive, and inequitable system, certainly in this country? And it's partly because of this. We haven't really dealt yet with the fact that true disruption means threatening our existing product line and our past investments. If you think about every other industry, breakthrough products have disrupted those that don't want to think differently. In healthcare, we've done everything we can, at least in America, to preserve the insurance system, the hospital system, the pharmacy benefit management system. And the key that I see happening, and I think what Sheba has done such a great job of, and what we will talk about, is how we can bring some of those things together. So I worked at Apple in 2000. The stock was 15. That was 8,700 splits ago. And I did not keep my options. I think I bought a stereo, or else this is named after me. But if you read the book, you'll see that one of the forwards is from John Sculley. John Sculley was the CEO of Apple. He's been my mentor for a long time. He's the guy that came in to basically corporatize Apple. He tells a story about, he went to Steve Jobs and said, we need to create a 3-year strategic plan. Lots of spreadsheets. I'll give you McKinsey. Here's how we did it at Pepsi. And Steve came back about 12 hours later. He said, this is all you're getting from me. Year 1, we change. Year 2, we change the industry. Year 3, we change the world. And when you think about it, they followed their strategic plan. He talked about the old math being computers and operating systems. The new math being this thing called digital lifestyle. And people said, hey, like you're either crazy or on drugs. He was on drugs, he wasn't crazy. But our entire math is computers and operating systems. As these guys know from Jefferson, when I got to Jefferson, I said the old math is going to be inpatient revenue, outpatient revenue, NIH funding, and in-person tuition. The new math is going to be how do we really start to truly partner with the new world of healthcare at home and healthcare at any address. So what I'd like to do in 3 or 4 songs is just go through how I think through Sheba and through some of these partnerships, we change the industry, and we change the world. Looking back from 2032, disruption requires bravery and the willingness to overcome inertia and discard, throw away the systems that fostered it. You know, too many people were propping up a broken, unfriendly, inequitable, and expensive system because they were afraid to break it. So in 2022, we had to launch the creative disruption of a system that denied equity in health and made it hard for people to thrive and be happy. We called it the uncomfortable revolution. This song that I'm playing for you now became the anthem for that movement by Sia, The Courage to Change. So if you think about it, when I got to Jefferson, things were like most hospitals. At that time we were 2 hospitals, we eventually became 18. But I started with that sort of, what do I think is going to change? And I made, if you looked at my whiteboard back in 2014, I had these 6 things up here that eventually will be paid based on quality, cost, patient experience, and outcomes. That our hospital stays, which at that time were about 80% of our revenue. Just to give you an example, in 2013, 35% of our revenue was joint replacements by a single orthopedic group. That is now 0% of our revenue because all of that has moved to the outpatient side. It took us about 30 years to get doctors and nurses to work together. We're going to have to figure out how to get doctors and robots to work together. And that turned out to be right if you read Elon Musk's thing about OpenAI. And by the way, if we're going to have to work with robots, and robots are going to be a hell of a lot better than we are at memorizing the Krebs cycle, maybe we should stop admitting students just based on science GPA, MedCats, and organic chemistry grades, and somehow be amazed that doctors are more empathetic, communicative, and creative. And then finally, and what's really been my passion now, is how do we turn population health, predictive analytics, social determinants, and health equity from nice philosophies, from grants deciding whether or not there's a 20-year difference in life expectancy among zip codes in New Jersey or a 25-year difference, and start to use technology to really be the mainstream of clinical care and payment models in a way that isn't just making the wealthy healthier. So at Jefferson, we did some interesting things, but we did 7 mergers in 5 years. The one that was probably the most impactful, and we have some folks here from that, was a merger with Philadelphia University. Philadelphia University was number 3 fashion design university in the country, and we were a 197-year-old academic medical center. I got accused of taking my personal life into my professional life because I had married the associate publisher of Vogue, but the real reason to do this was literally bringing the design of the human experience into healthcare was a game changer for Jefferson. We had a motto that says, can we as a 195-year-old academic medical center start to think like a startup company? And if you came to my office in December 21 when I left Jefferson, I had this sign that says, I hope 5 years from now, when Elon Musk brings people from Mars to Philadelphia and says, where's Jefferson? You can't define that. I mean, Jefferson at Liberty Science Center, Jefferson on my phone, Jefferson on my TV, Jefferson on 12 micro hospitals, Jefferson at Sheba. Oh, you mean the place where really, really, really sick people go? I think that's still a 10th and Walnut. Over a drink tonight, think about this. We're the only industry that defines ourselves by where we failed. We are a health company. So in essence, we're defined by where we failed to keep people healthy. So we started to redefine Jefferson Health based on a motto of healthcare at any address. We also made a decision that we weren't going to be a spectator in this $40 billion a year digital health piece. So literally at the point that I left Jefferson, we were making almost as much through our digital partnerships as we were through our 18 hospitals. And I think a lot of what we're going to talk about with Sheba is how do we really create these partnerships with startup companies. We have Nadav Shimoni here from Arkin Holdings, a very large family foundation that I advise. How do we start to create partnerships instead of vendor-vendee relationships? And I think that's one of the things that I think can come out of this piece. So I think the we change piece has to be, whether it's boards or health systems or industry, literally getting out of this very risk-averse model. Here's the second song. Another golden oldie looking back from 2032. Wow. That pandemic of 2019 and 2020 taught us a simple truth, that we needed to move from a physician and administrator as the boss to patient as the boss. Duh. Interview, even back in 2022. Now it's throughout the galaxy. But we act in healthcare as if we're patient-centered for that one patient. Well, we had to understand health assurance is totally different for a disaffected 22-year-old, an athlete with an ACL tear, a 64-year-old with an Oura Ring, a Fitbit, and an Apple Watch, and an 80-year-old with terminal cancer, or a 50-year-old with a high A1C that's making him depressed. He does not feel like he's a diabetic patient. He wants to be a person that can thrive without his diabetes getting in his way. But when we talked about consumer segmentation in healthcare back in 22, we heard words you never heard in the Bible. As Paul Simon and Art Garfunkel said, you've got to keep your customers satisfied.
Just try to keep my customers satisfied.
So we're at an inflection point, and I'm going to show you a Harris poll that's going to be a little bit depressing that just came out. But we are at the sort of patient saying, you know, hey, I'm mad as hell, I'm not going to take it anymore. And if you don't believe me, for those of you who come from health systems, just look at One Medical getting sold for $3 billion. One Medical said, I don't believe that you guys can really see people within 15 minutes that have money that are willing to pay for it, and be really, really nice to them, and just be incredibly consumer-centered for folks with chronic diseases, so we're going to do it. And literally within 5 years created a $3 billion company on our backs. And some of the stuff like this cartoon, try to get some rest, I'll be in every few minutes to make sure you don't, are real, and certainly are real in most of our places. So this is a Harris poll that got done about 3 months ago. Actually got sent to Congress. And probably the most indicting piece is that 62% of the respondents said the healthcare experience feels like it's intentionally set up to be confusing. It's not, but literally that's how folks view us. So I got a chance through a series of events to meet this individual, Hemant Taneja, who had just written a book called Unscaled. And the concept behind Unscaled, General Catalyst had been the initial investor in Airbnb, Warby Parker, and Stripe. And the concept being that it used to be if you want to build a bigger, better hotel chain than the Marriott, you had to build a hell of a lot of hotels, thus Airbnb. If you wanted to provide better customer service than LensCrafters, put stores next to them in the malls, Warby Parker said, no, we're just going to do that, connecting people, and then Stripe did the same thing for fintech. So we wrote a book together and created a concept called Unhealthcare, that how can we start to use some of the technology, sensors, and AI-based digital therapies to have costly sick care give way to affordable, personalized, and preemptive care for all. And that's really been the passion of my time and research, and where I first met the Sheba folks. And the ability to get away from this sort of the iron triangle of access, quality, and cost, and what we call the patient diamond of health assurance. The ability for patients to thrive and not have health get in the way. The ability to connect and have human relationships when they need to. The ability to easily navigate on their own terms, and the ability to understand what they need to do. Looking back from 2032, it took us 20 years to get doctors and nurses to work together as equals, and another 10 years to train clinicians and robots to act as partners from 2022 to 2032. The health tech revolution moved the needle in unprecedented ways. What entrepreneurs understood was the need for radical collaboration with the traditional healthcare ecosystem. That brought artificial intelligence and machine learning and drones and robotics into the mainstream of healthcare. At the same time, clinicians could do what we do best, keep the human in the middle. You know, the robot can analyze billions of data points and remember them. So who cares whether or not the human can memorize the Krebs cycle? The doctor, though, has to be prepared to answer when the patient asks, what does this mean, doctor? What does it mean to my life? And that's where this great song from Styx comes in.
Domo arigato, Mr. Roboto, domo.
And that's one of the things that Sheba has done such a fantastic job of in changing the industry, creating a new educational paradigm. How do we learn from our mistakes? You're going to You're going to hear from Dr. Amitai Ziv in a minute, who's been my partner for 25 years in simulation. Both he and I are pilots, and every 2 years, we have to get our technical competence assessed. As a surgeon, the last time anybody's checked my technical competence was about 40 years ago. So you're a hell of a lot safer flying with me than being operated on by me, at least by objective criteria. So how do we start to use procedure rehearsal studios so we really don't make the same mistake over and over? Like that guy, we sort of keep making the same mistake. What Sheba has been the leader in, and what you'll hear from Amitai, is how do we get away from this see one, do one, teach one model, right? Which is great unless you're the one on the other end. When we started our simulation center in partnership with Sheba in Tampa, we had, if you remember, the co-pilot of the guys that landed in the Hudson. He said, the way you guys do medical education would be like if I got this brand new Airbus that I'd never flown before, and I went to United Airlines and said, hey, could you put like 560 people on this and let me see how this sucker flies? The fact is that what Amitai's been able to do at Sheba that we replicated is how do you start to use simulation for assessment and of technical and teamwork competence? I learned how to intubate a 1.5-pound baby in a chaotic delivery room with the dad over me. Literally at Sheba, you don't do that till you've proven that you can do it on one of these guys. So Sheba and LSC are teaming up to create this amazing hospital of the future simulation space. It'll be a showcase not only for what healthcare looks like, but where everybody from around the country that's part of this, that's invested in this, can literally bring their physicians and other folks in. The US version of Sheba's world-renowned medical simulation center will be led by Dr. Amitai Ziv, educating the workforce of the future, assessing and improving technical and teamwork competence. And then the important thing is it will inspire loyalty. In other words, accelerating healthcare transformation by bringing some of the groundbreaking Israeli technology to solve future health problems. Bringing folks together like you from universities, pharma, and others to really make that kind of difference. Looking back from 2032, back in 2022, we in healthcare were way too slow. I remember Jeff Bezos used to talk about disagree and commit. In healthcare, it was always consensus and unanimity. You had to get 12 cabinet members and 18 lawyers together to do something in 6 months. And the reason other sectors were able to move forward in a quicker way was because we hadn't learned that urgency. Well, what happened? The concepts of radical collaboration, radical communication, and a radical cut in bureaucracy became the trifecta for not just vaccine development, but for cutting through the ridiculous bureaucracy and fragmentation that defined healthcare and really all of science in 2022. The miracle of the COVID-19 vaccines became the framework. Remember, 6 months to get from beginning to vaccine for the healthcare policy of the SWIFT presidency. Remember, be Taylor, be Swift. Namely, when it comes to someone's health, we have no time to waste. Just think about it. What, just like Justin and Madonna, would you do if you only had 4 minutes to save the world? I'm out of time and all I got is 4 minutes. So what about changing the world? I think the key is going to be how do we take technology and humans together to really start to make healthcare for all make sense? And one of the things that we've really been concentrating on, and there's quite a few companies out of Israel doing this, is my car gets better care than I do. When I get home to Miami, I will turn on my car and say, hey, Steve, while you were away, my right front passenger, based on your blood pressure, your calcium score, 3 or 4 other things, this is what you should do for the next 18 months. So I think what we'll start to see and what will be developed here is how do we continue some of that continuous type of data coming from an individual, from getting away from the I have 5 Apple Watches and 4 Fitbits to this kind of thing.
You had 5 asthma attacks last week, David. What's going on?
Not feeling well. I got a cold starting. Had to go to Barstow twice for work.
Barstow's nice and dry. What's your asthma keeping you from doing?
Yeah, well, normal life for starters. Like walk upstairs, play with the kids, go see a movie.
Okay, well, here's some weather for you, and I can't say it's nice out. Your neighborhood AQI is 160, humidity's down, and particulate matter's up, so you'll have a 65% increased risk of an attack today. You got some popcorn in the house?
Sure, I get it. Not going out today.
Right, and keep your Advair inhaler nearby.
Okay, every 2 hours I take one shot, right?
That's it. You want me to remind you when you need to take it?
Send me an SMS.
Okay, talk with you soon.
And this is not gimmicky. I'm an obstetrician. We spend 4 times more per obstetric patient than any country in the world, and our outcomes are somewhere between number 25 and 30. In fact, there was just an article in the New York Times that maternal mortality and morbidity is higher than it's been in 30 years. Some of that is because if you need 3 non-stress tests a week, in the United States, you have to go to the hospital 3 times a week. Doing things like this and making this more convenient, because my daughter would be able to go to the hospital 3 times a week based on her ability to pay somebody to watch her other children or getting off from her job. But an employee that can't do that or somebody that can't afford a nanny would not be able to do that unless they can get those kind of things at home. So how do we take trust, education, and technology? And I just want to sort of end with this piece, that education is probably the single most important thing, and that's what I love about what you're doing in the Liberty Science Center, because technology without education can really result in some mistakes.
Fall, and it'll be an exercise in building trust between one another. So Harrison, if you don't mind going first, step up here on this chair and close your eyes. All right, and then everybody fill in, and we're going to ask you to fall, and then they will catch you. So you have to trust us. I'm going to count to 3, just relax and fall, okay? 1, 2, 3. No, wait, no!
So again, technology without education really doesn't work. So I think what you'll see as you start to hear more about what we're doing with Sheba and Liberty Science Center, and certainly we would love you all to come to Tel Hashemir in our Innovation Week, but is that Sheba and LSC are really working to create that kind of responsible innovation, creating that strong, sustainable partnership between technologists and providers, educating current and future healthcare professionals to responsibly use new technologies and innovations in a way that recenters the healthcare experience to focus on the relationship between the needs of individual people and their care providers. So I'm going to leave you with a quote from, I'm a big Star Wars fan, and we talked this morning a little bit with some folks about the importance of curiosity and creativity. And what brings you all together is curiosity and creativity.
Because without getting docs to be more creative, they are doomed. You must make sure that the conference happens. Steve Klasko, an OBGYN doc from Philadelphia, will talk about creativity as a skill set, he will. That program will produce doctors who go home and defeat the dark side of non-creative healthcare. That group became the core group for an optimistic future. Learn what you can from the OBGYN doctor. And may the forceps be with you.
And most importantly, we really have to start now. Thank you very much.
More entertaining, though. Dr. Eyal Zimlichman is currently Deputy Director General, Chief Medical Officer, and Chief Innovation Officer at Sheba Medical Center, ranked a top 10 world hospital 4 years in a row. Prior to this, he held the position of Chief Quality Officer at Sheba. Preceding his work at Sheba, Dr. Zimlichman held the position of Lead Researcher at Partners Healthcare Clinical Affairs Department in Boston, where he was involved in the efforts to bring about a strategic care redesign initiative. In that capacity, Dr. Zimlichman has established for Partners Healthcare a program for collecting and reporting patient outcomes across the continuum of care, a program that won international appraisal. Dr. Zimlichman holds the appointment at Brigham and Women's Hospital and Harvard Medical School affiliated Center for Patient Safety Research and Practice, where he is conducting research on implementing technology to improve quality and patient safety. In 2007, Dr. Zimlichman was selected as a member of Sheba's Talpiot Medical Leadership Program, a program aimed at advancing the brightest young physicians into leadership roles. And he's led that program since 2017. Dr. Zimlichman is a graduate of Harvard School of Public Executive Health Healthcare Management Master of Science program, and earned his MD at the Technion in Israel. I welcome Professor Dr. Zimmerman.
So we're going to try to bring it all together now. We've heard from Paul, of course, about the huge vision that they have here with SciTech City. We've heard from Steve about the future of health. I'll talk a little bit about that, but of course, I think Steve got a very vivid view of what the future of health needs to look like. And how do we bring it all here to converge in New Jersey? I'm going to take you on a little journey over the next 20 minutes to try and make sure you get the full picture of what we're trying to do here. That'll be followed by Amitai Ziv, who's going to speak about what he's been doing in simulation, really the leading person in medical simulation in the world, the founding person of medical simulation in the world, and what role simulation will play here in this very exciting initiative. And then we'll wrap it up with Orly, who's going to tell us how we're going to make it happen. Orly is going to be the manager, the CEO of the new LSC, Liberty Science Center, ARC Health Space 2030. So let's start by talking, okay, we'll start. Okay, I was wondering which one. So let's start by a couple of words about Sheba, because I don't know how many of you are familiar. Sheba is a very large institution, largest in Israel, largest in the Middle East, basically one of the largest hospitals in the world, 2,000 beds, all on one campus. For example, as you'll come in, I apologize in advance because of traffic, 25,000 cars on average that come in every day, and about 40,000 people that walk in through the gates. Huge, huge operation in the middle of the country in Israel. Very, very large, but also very good institution. Over the past 5 years, we've been able to sort of put global institutions on one list through Newsweek. Newsweek is the only ranking in the world that ranks all hospitals on one list, and Sheba was ranked in the top 10 over the last 5 years, institutions in the world. So, of course, that has put a big spotlight at Sheba, and we're actually using that to create more and more partnerships and drive our vision forward. So about 6 years ago, I was asked by a new CEO, Professor Yitzhak Kreis, our current CEO at Sheba, to head innovation. I was the chief medical officer. It seemed quite strange that the chief medical officer would also run innovation. Sometimes these two things are conflicting, unfortunately. From my perspective, it was an opportunity to do two things. One, as somebody that really knows the problems of healthcare, my origins are patient safety, quality, understanding where the gaps are. I always say, noticing the half empty glass. You know, some people look at the half full glass. People that deal with patient safety and quality tend to look at the empty glass. That's what I was doing most of my life. So the challenges were straight in front of me for every day and every minute of my professional career. So being Chief Innovation Officer allows us to try and bring solutions to the many challenges that healthcare faces that we were not able to solve. I have to bring one example up. Just about a month ago, we had a publication on the New England Journal of Medicine that has shown, in patient safety perspective, that harm for patients in hospitals has not changed over the past 30 years. Zero improvement in 30 years since 1991, when we knew about the problems that we have in hospitals with unintentional harm. So we definitely need to start thinking differently about those problems and not trying to work harder or, next time we'll get it right, which has been the motto over the last 30 years. Let's try to think about this differently. So I had this opportunity to come in and have innovation play a role to tackle those many challenges that healthcare is facing, not just on quality and patient safety, but health equity and sustainability and patient-centered care and workforce crisis and burnouts. All these problems we don't currently have good solutions for. To do that, we decided that what we're actually looking to do is transform healthcare, answer to those many problems, but not do it only at Sheba Medical Center and not only in Israel, but do this globally. Now, when you're setting an objective or an aim like this, you also have to set a date, right? So we said we want to do this by the year 2030. Now, 2030 back in 2017 seemed miles away, and we're very confident that we have a lot of time to work on this. But obviously, I say to my team every day, the clock is ticking, and 2030 is around the corner, and there's a lot of work ahead of us. So what we've done is we've established ARC, which stands for Accelerate Innovation to Redesign Healthcare through Collaborations. Collaborations are critical. And basically, what we're doing right here in this room is that critical element of collaborating to change the future of health, to change the course of where healthcare is going. Because otherwise, 30 years from now, we'll sit here and say, we've done nothing, we've made very little progress over the past 30 years, unless we move in a different direction. So figuring out ARC, and this is a photo from the launch of ARC towards the end of 2019, so ARC is basically just about 3.5 years old. Understanding that we need ARC was easy, but the problem was when you say transformation or when you say redesign, we all like using those words, the next question we have to ask ourselves is redesign into what? Transform into what? And when you ask every person, everybody has a different idea of what the future of health needs to look like. And if we each have a different idea, we each move in a different direction. And then, obviously, we're much less likely to get there. So we had to build up another initiative. We call it our sister initiative called FOH, Future of Health. FOH is a think tank of leading organizations from around the world, all the stakeholders, much like what we're seeing here today, providers, payers, industry, policymakers, politicians, patient advocacy groups, academia, all coming in together to draft a vision of the future of health. Try and make it as vivid as possible and try to come up with understanding of how do we get from here to there. How do we make it by 2030? Because that was the objective. This is a photo from the last get-together of FOH in the Jerusalem Hills about 4 months ago, which was the last time we got together. We were meeting both physically and virtually to draft that vision. You see here the institutions that are part of FOH, and I have to say we have to add Merck to the picture here. We just signed with Merck to come into FOH as the first pharma in FOH. And without going through all the names that you see here, there's plenty of them. And the diversity, all the way from Mayo Clinic and Stanford to Microsoft and 3D Systems and other companies. But really to note two things. One is that everything at FOH is being done through very concrete research. We have the Duke Healthcare Policy Center headed by Mark McClellan, who's a close colleague of ours, work on the research side of really trying to reach consensus between this diverse group, because obviously everybody wants to take this in a different direction. How do we reach consensus? So we have the Duke research team work with us on reaching that consensus towards the end of every year. And then the New England Journal of Medicine that you see here is another partner. We publish the work that comes out of FOH on the New England Journal of Medicine. We've had 3 publications out. We have 3 others that are going to come out during 2023. And this is now setting sort of a guideline to the world. We know of governments, we know of large institutions and industry that are looking at this as a blueprint of what they need to do in the next decade. How is the changing landscape going to impact each one of us wherever we come from? So this is FOH. FOH, in many ways for us, as I've said before, is the guiding light. FOH sets the vision. But then you'll all agree with me, and everybody that worked in healthcare would understand this completely, that setting the vision is the easy part. Turning the vision into reality is really the challenge. And do this on a global scale is obviously much more challenging than just doing it in one institution. So ARC was built as a transformation engine. It was built as a transformation engine that would couple to FOH vision and turn that vision into reality. To be able to do this on a global scale, we built ARC with a strong strategic focus and 4 strategic principles. I'll run through them very quickly. Of course, we won't have the time to do the deep dive, but happy to do this at any other case that we can. One is focusing on digital health. Steve mentioned a lot about digital health, and we know that digital health is the main transformation engine for the next 2 decades. Much like other industries, like banking, were changed completely through digitalization, healthcare is next in line. Before COVID, I had to spend a couple of minutes to explain why. I think after COVID, you will all agree. For Sheba, it wasn't an easy decision. We were very focused on pharma and medical devices in our innovation efforts, so we had to build our capacity in digital health since 2017 when we made that decision. So that's number one. Number two is open and organic innovation. Organic innovation is what academic institutions do. We do research, we create intellectual property, we like to take that intellectual property to the market, and that sometimes can create changes in the industry and also bring back money to the institution. This is called commercialization or tech transfer. Well, organic innovation is great, it's important. For Sheba, it was a cornerstone to what made us so successful. But if you're going to actually see transformations happen, you have to have an open innovation platform. Open innovation means we're constantly looking outside of our walls to find the best technology out there, perform the right due diligence to make sure it's the proper one, on board to our institution, do a proof of concept, and then wide-scale implementation so that it can actually create value. Only that wide-scale implementation can happen globally and not just locally, with all the ARC members, which you'll see in the next few slides. Open innovation platforms are not existent in about 95 of organizations. Think about it. Most of our organizations do not have that capability to be able to constantly scout outside and find technology that we want to check inside and scale up. So that requires an effort to build as an infrastructure. And this is the second principle of ARC. The third is international collaborations. With the modern world and technology in our fingertips, we're able to find the best partners to work with. The fact that Sheba Medical Center from Israel is here to collaborate with the parties in New Jersey is really thanks to technology. Not because of airplanes, they've been around for a long time, but because of technology like Zoom and Teams and Google Meets that allows us to talk on a day-to-day basis and work together. The fact that we're meeting here physically is, just taking an opportunity, but the work is done virtually. And modernization allows us to do this. So we need to find the best partners, period. Not just across the street so we can have a cup of coffee with, but where are they around the world? Like-minded organizations that share the same values and the same aspirations and vision that we have, that we can work with much better than with others that might be just closer to us because we share the same geography. So international collaboration is a critical element to make transformation work. And finally, it's a structured approach to innovation. We firmly believe innovation can and needs to be structured. We can scale up innovation many, many times fold. We can accelerate innovation many, many times fold if we follow a structured approach. Some will tell you innovation is magic. It either happens or it doesn't, like magic dust that you can use. And if you don't have it, well, tough luck, try something else. We think that's not true. We think innovation needs to be a structured process. Innovation cultures can be built where they are non-existent. Just like we were working on patient safety cultures back in the days, we're able to measure innovation culture, we're measured to impact innovation culture. And this is a cornerstone at ARC, being able to structure it and build that culture and expand that culture. So as we talk about ARC and specifically where we're focused, these are a couple of areas that you see here without doing a deep dive into all the bullet points we have. These are the areas we're focused on. These are the areas that will change healthcare over the next 2 decades. And we've made substantial improvements and innovation throughout the topics that you see here. Each one of those at ARC is a hub. Each hub has a leader, has a team, has a budget, annual milestones, a conference once a year, at least one hackathon a year. This is our ability to make progress in these 5 very important areas. And this is what we want to bring here as well in terms of our focus. We have 90 startups at ARC, 90 startups at ARC. You see them here. These are the startups that will change the future of healthcare. Half of them have come from within Sheba based on our own intellectual property. The other half are companies we've identified through our open innovation platform and have invited them to join ARC and to change the world together with us. These are all tested technologies that have been proven to create a difference. I'll share with you one very brief example. I'm sure a lot of you have heard me mention this already. A company called ADOC or AI Doc. 2016, 2 guys coming out of the Israeli military. What they were doing in the military is they used AI to be able to read satellite images, understand things from the satellite image that the human eyes cannot understand. They came to us and said, listen, we'd like to do something in healthcare. I told them, well, I'm sorry, satellite images we don't have at Sheba, but CT scans as many as you'd like. So they started working on the CT scans. Within 2 years, they had a working product that was reading CT scans in the emergency department, diagnosing life-threatening situations like stroke, like pulmonary emboli, like internal bleeding in milliseconds, when the radiologists in the room can only get to them, by the time he gets there. That has dropped mortality in these conditions at Sheba by 10%, saving on average 20 patients a year, but on top of that, reducing cost considerably because of these solutions that create higher effectiveness from radiologists. Fast forward, this company called ADOC left Sheba in 2018 to conquer the world, but in 2022, they're deployed in 1,200 hospitals around the world, 800 here in the US and 400 outside of the US. Multiply the 20 patients we're saving a year through this technology times 1,200 and get to real global impact that innovation can create. And this is just one story out of many. So startups are critical in our community, but of course the large industry is critical as well. Steve mentioned the vaccines. We were saved by the big pharma. Some of us in the provider roles like to think of pharma as maybe an enemy sometimes, but pharma are a critical element of our ecosystem. They have to be at the table, both at FOH when we talk about the vision of the future, as well as when we define the solutions that will change medicine. You see some of the partners here, not just in pharma, but also medical device companies and others. I won't go through the names you see here, but we work very closely with all of them to create new solutions and take those to the market. If I had more time, I would have given you a couple of very neat examples. And then finally, of course, it's the other academic medical systems around the world, like-minded organizations like Sheba that are looking to create that global impact. And we're working very, very closely together, about 35 systems in about 15 different countries. We noticed that we have at least one representative in every continent, apart from Antarctica, all continents in the world. You see the names, I won't go through them, really leading institutions in the world. This is something that is working very, very strongly on the day-to-day basis, where teams from Sheba and teams from the institutions you see here are creating new solutions that can have a critical impact on how we all deliver and receive healthcare of the future. All of this together is the ARC community. About 140 members around the world. By the way, we get together physically once a year during the ARC Summit in Tel Aviv, 3 days in June. This year it's 13 to 15. We'll be happy to invite you to come and see this wonder with your own eyes when you stand on stage and see 1,000 people in the audience that are all ARC members, that are there for 3 days to work very hard to make a lot of partnerships, come up with new ideas. What we do in 3 days during the ARC Summit in June propels us forward with the energy for the entire year until the next ARC Summit. So it's really something exciting to see and coming soon in June, and hopefully some of you will be able to join us on that. So we've taken ARC globally because ARC has really been creating a lot of attention around the world. Actually, in 2018, we were approached by a hospital in Canada called Ottawa Hospital, Ottawa General Hospital. It's the largest hospital in Canada. Some of you might know about it. They came to us and said, listen, you guys have figured this out. Why don't you come and build us an ARC? It never came to our idea that we would be building ARCs around the world. But we said, well, if this is a structured approach to innovation, why not do this elsewhere? And so we worked for 6 months with Ottawa Hospital to build an ARC in Ottawa. We launched in 2019, just before COVID. We then went into the shelters for COVID like everybody else. But then after that, we started working again. And by now, there are 3 ARCs in the world, one in Canada that I've mentioned, one Northwestern in Chicago has an ARC, and Great Ormond Street in London has an ARC as well. We're working on many, many new others right now, currently working in Bahrain to create an ARC there. Of course, extra exciting for us to working with our Arab neighbors after the Abraham Accords. And we're starting to do some huge project in Victoria, the state of Victoria in Melbourne, Australia, where we're working with the city to create an arc for the city of Melbourne that will put together all the universities and all the academic medical centers and the accelerators and innovation funds into one strategy that will push innovation for transformation and for engine of growth for the economy in Melbourne, Australia. And many, many others are now on the table in terms of the next couple of years. We have a huge project in Chicago centered on health equity, working with the 8 academic medical centers in Chicago to bring technology and innovation, but not only the technology side, also the health delivery models to tackle health equity in the south side of Chicago. This is being built now in South Chicago, in the neighborhood of Bronzeville, if some of you are familiar with Bronzeville, where Michael Reese Hospital used to be, same grounds. And this would change the city of Chicago in many ways. The city is involved, the state is involved. A lot of eyes are on this project to see whether or not we're able to move the needle on health equity, huge challenge. And of course, the next project is New Jersey, and this is what we've convened here for, and you'll hear much more from Orly about the project here. To really summarize all of this together, you know, as we start putting these critical elements, first of all, of a vision of the future of health, which we heard a lot from Steve. And of course, there's much more coming from our FOH group. And then, and those of you interested, of course, the 3 articles already published on the New England Journal of Medicine, of course, are available for everybody to read. You take that vision on one end, and then you say it's not a question of let's just wait on the sidelines for this to happen, but rather let's play an active role in making it happen. Let's not just be passive and be, you know, a late adopter when things come to us. Let's be there to write the new textbooks of medicine that will change completely how we're doing things to be much more efficient, more effective, much safer, higher equity, and so on, all the problems we've mentioned. This is what we want to do here in New Jersey. And before I pass it on to the next speaker, I just want to show you the new ARC building. We're now starting to build at Sheba on our campus, a little bit bigger than our own building, which is just 2 floors currently. If you'll come to visit, you'll see. This is the new one, 20 floors, 1 million square feet of innovation space. 30% of those would be wet labs, 70% open space for innovation. This is built right on the Sheba campus. With a light rail, 15 minutes to Ben Gurion Airport. There's a station right there, 15 minutes to center of Tel Aviv. And I'm sure many of you know the traffic problem, so that's a game changer. And this is the reason we're building such a large building is not because the ARC team needs 20 floors and 1 million square feet. We just need probably 1 floor out of this building. But the fact is that we've started building it because we got huge amount of requests to move into one physical space. And so all the members you've seen in many countries, many industry partners and startup companies will physically have a presence in this one big building at Sheba that will open in 2026. A lot to look out for. We hope to bring much of that here to New Jersey. We want this to be a driving force also for the economy, on top of course, the huge amount of transformation in the healthcare that we're looking to create. So I think I'll finish here, and thank you very much.
Thank you, Professor Zilmuchman. Okay, Professor Amitai Ziv was trained as a pediatrician at Hadassah Medical Center and the University of Pennsylvania Children's Hospital. He is responsible for risk management, quality assurance, and medical education at Sheba Medical Center, as well as heading up Sheba's renowned rehabilitation hospital. He also established Messer, the Israel Center for Medical Simulation, which he runs. Professor Ziv has served as a consultant for the Educational Commission for Foreign Medical Graduates International Clinical Skills Assessment Programs in Israel, Spain, Brazil, Russia, Ukraine, Italy, and the USA, where he was a member of the test development team in Philadelphia. He is a world-renowned expert in the field of medical simulation and has been invited to speak at medical conferences worldwide. He is the recipient of national and international awards for humanitarian action and for leadership and commitment to the applied health sciences. Dr. Ziv also has served as a member of 2 WHO Patient Safety Alliance expert working groups on medical school patient safety curriculum and on patient safety technology. Professor Ziv has published and presented over 60 papers in peer-reviewed international journals and at international conferences. And it looks like we got the computer hooked up just in time. I welcome up here Professor Ziv.
I really hope that the presentation will come up. We should have simulated it before, but apparently simulation didn't work. Let's hope it will. Are we okay? Let's see. If that doesn't work, we'll work with what you have over there. Just let me know. In the meantime, so where are we? Do you want to work with the one that I gave you over there with no video?
I could also just move your laptop and bring you the mouse.
So please do that. So that's the mouse.
Let me try actually one more thing.
Sometimes you change the order. One more try and then we'll move it on. So, if you can give me the mouse and put it on from the other one.
Let's go ahead and use what we have preloaded.
Okay.
Yeah, do that. In the meantime, I'm really honored to be here with the distinguished guest, and thanks Eyal and Steve and of course Paul for the previous presentations. Doesn't work. Okay. Let's hope it will come up in a moment, and we'll start the presentation as we speak. But practically a few words about Jersey and my own experience. We lived in Philadelphia for about 5 years. I was at UPenn and then at Jefferson, working with some bodies over there, with some simulation companies that stemmed out of the Israeli Air Force. But Jersey has always been a very, very important site with my family. The one place that we went on almost at least once a month was Liberty Science Center, rather than Franklin Institute in Philadelphia. That was, what, 25 years ago? Good. I need a mouse. And then Jersey is responsible for a lot of the funding that came out to Messer Russell Berry Foundation, which is a supporter of the, thank you so much, which is a supporter of this very project, has been supporting Messer for many, many, many years as well. So let's move on. I strongly believe that simulation is a very important element of moving forward this concept of health space 2030, and it's certainly a platform to drive innovation and design the future. So practically, Messer in Hebrew means this the acronym of Medical Simulation Center. But there's a value message embedded in that word. Many Hebrew speakers in the room would echo that. Messer is a value message. Let us err in a safe environment. Litot is to err. Lithot is to reflect. That's the concept behind simulation. Let's err, reflect in a safe environment where you can actually do better in the real environment. So I was introduced to, I was introduced to simulation, obviously, as a fighter pilot in the Israeli Air Force, and you may think that the two fields are very, very similar, meaning intolerance to errors or intolerance to not missing an opportunity to learn from errors. But we are here from the healthcare services would echo that we are far behind aviation. And in fact, in all those aspects in the bottom, but one of them is the unstructured introduction of technology. All technologies in healthcare, software, hardware, are introduced into healthcare environments on real patients. All the errors are eventually done and run on real patients. So with that in place, I found myself kind of very shocked, perhaps, when I moved from aviation to medicine and kept on flying on reserve for many, many more years. There are three themes I think that medicine lacks big time that are part of aviation: competence, readiness, and reflection. We should check ourselves seriously, are we doing good enough in that respect? And we were hit very badly at the beginning of the 21st century. It should move on, but it doesn't. Mouse, right? Mouse doesn't work. You see? Okay, here we go. So we were hitting the turn of the century into the 21st century with a to-air resuming report that told us that we healthcare systems or healthcare providers as well are the number 3 killer in the world via medical errors. Not intentionally, but we, US hospitals, only crash 4 Boeing 747 daily because of medical errors. These are obviously passengers who are not so innocent. They might be on a terminal illness of 2 more months to go, but the fact that we gave one of them the wrong drug or the wrong dose shortened their life by 2 months. That's in the statistics. So we were hit badly as we moved into the to this century, and it's not about a bad doctor or a bad nurse or someone with bad intention. It's a bad system. Bad system in all aspects, as Steve beautifully related to us, and in that respect, we could really. What's happening here? Would you help me over there? You see, you need to simulate before you actually do that. I thought we did it, but we did not. What's that? No, this is not here. I'm not using the laptop. It's there. I wish it was on my end. I have no control. Yeah. Can we move forward? I'll have very minimal control of a lot of my video clips, which is a pity. And so we were hit with the need, to really change a paradigm, change our culture, and really, really move into the 21st century along the lines of what Eyal and Steve so beautifully shared with us. So why simulation? Because simulation is error-driven. It allows us to err. Simulation is nightmare-driven in many aspects, not only in terms of the clinical heroic work, but also nightmare of admitting an error and sharing with the family that something really bad happened. And it's also a safe place for R&D, really to test new technologies and to really accelerate R&D as we move on with this dynamic field of medicine. But obviously, as regards to education, it has so many advantages, one of which is reflection. Let's reflect in the safe environment before we move into the real environment. So this is simulation. Can I show the video or can I not show the video? I'm not happy, as you can see. Let's give it a try. No, I think we're stuck. Oh, I don't want you to do it because practically I shortcut it big time. We don't have time now to do a 1-minute video. I shortcut it. But practically what you have just missed is a lady who is simulating, who is in a simulation exercise challenge of delivering a lady. Low-tech simulation, an actor, an actress, a very low-tech mannequin, and here we are running a delivery exercise. This very exercise could really go bad, and the mannequin comes out delivered with no vital signs at all, and here we are in a resuscitation of a newborn. No fun, believe me, as a pediatrician. But then the mannequin is out, starts to scream, and we're seated in a debriefing room, and we view ourselves in reflection. That's the beauty of simulation. Very simple, very simplistic, but hardly done in medicine in general. So if we move forward, what we look into our SIM center is pretty much to go into the higher order skills, not just the technical skills. It's not so important. And safety, as Eyal mentioned, is not about knowing the protocol. It's about applying the protocol. So safety protocols, how do you work with an EMR environment, ergonomics, the interface between a human, a technology, and a patient, and the environment, obviously, teamwork, multicultural. Many of our mistakes would take place on the underprivileged, those old age, the underprivileged. We need to learn how to work with those society sectors, and certainly the reflective skills. So the good news is that simulation is here to stay. There are many driving forces listed here, one of which is obviously the accountability of medical education. We did not have a good product line until now. We're trying really to improve the product line of health professionals at large. We need to accredit ourselves on competency and not only on knowledge. And there's liability aspects, and simulation industries out there helping us. So when we talk simulation, it's not just the high-tech, if you were thinking of high-tech. It's the high-tech simulators, but it's also the high-touch simulators. Actors, role-playing patients would be great challenges for us as health professionals. So that's the low-tech, high-tech, high-touch. Altogether, that's the approach we took in simulation. And as you can see here, many of these very high-tech videos that you don't really see are about robotics and lap mentors and arthro mentors and carotid stenting and many others. These are simulators that stemmed out of Israel, Symbionics company that was acquired not too long ago by a Swedish company, Surgical Science. We have all these simulators that allow us to actually to train on all these procedures. The simulators don't do the job themselves. It's us, the regulators, who would force us to actually use those simulators and show competency before we actually do it. It's all a matter of courageous regulators. Apparently, in Israel, we were very successful in that respect. I think worldwide, there's still a long way to go. With that in place, we established MESSER about 21 years ago. MESSER is a national global resource for comprehensive training of interdisciplinary, multidisciplinary, all modalities, all environments of health professionals. And it's a place to really improve patient safety, to do hands-on training, not a lecture. Everything is hands-on, as Paul mentioned about this very place. Performance assessment, as Steve mentioned, and a lot of it has to do with introduction of new technologies into the scene before they actually are applied on real patients. As I mentioned, a culture change vehicle. So we built it, we started to plan it in '99, one floor, then another floor, then an auditorium, amphitheater, MESSER on wheels that is running around the country and doing a lot of simulation around the country, by the way, fully funded by Russell Berry Foundation from New Jersey. And many other sites within Sheba, and even in Jerusalem we have a simulation center that we operate on equity and on many other social aspects of healthcare. This is our new building that will host the Health Space 2030 on the Israeli side. The third floor will be that. 7,000 square meter SIM center, 6 floors, to be open at the end of 2024. So we'll be up and running most probably about a year before Paul and this very place will be up and running. So I don't have time now to go there, so you're lucky enough not to see the videos, but practically the videos would show our ability to run simulation on emergency preparedness. How do we deploy the field hospital to Haiti? These are not things that we do daily, but the delegation needs to be well trained for that specific environment. So we trained, the group that went over to Ukraine was trained by us 3 times in a row, all 3 delegations, before they went to Ukraine. You don't see here the work that we're doing with NATO on preparedness for earthquakes. So a whole earthquake site was formed in Israel. Under the rubble, we would put simulators and, of course, the people who work under the rubble. And we work as a team to really improve our ability to work in Turkey when we send and deploy some staff. Similarly, a video that you won't see again is the video of us coming into all Israeli emergency rooms. All Israeli emergency rooms would host us as a simulation on wheel body, where we would go to Shaarei Tzedek in this very place. with our mannequins. They would bleed, they would be unconscious. They're real body, full body mannequins, adults or all the way down to neonatal. Everything is videotaped, everything is run in the exact environment of those hospitals, and we do it with OBGYN, we do it with emergency rooms, we do it all around the country to improve our readiness to those events. Could be a terror event, chemical warfare, it could be a car accident, a mass trauma, etc. So these are the types of work that we're doing around the country. As I mentioned, Ukraine was a site where we deployed our field hospital. Sheba led that mission a year ago almost, right? It was March a year ago where we were there. And one of the tents was dedicated to simulation. These are our people training the local Ukraine people on being prepared for the collapse of their healthcare system. We left, by the way, all the simulators over there. We trained them how to train, and it was extremely productive. You won't see this one, which is the soft skills, how to deliver bad news. This gentleman is the head of a department. He is about to deliver bad news to this poor father that his son just passed away in the critical care. The two of them would be seated on the floor, both of them cry. The only simulation here is done by the actor, but he immerses the physician who is being trained, very, very senior physician, as we can see. He immerses him and they both sit on the floor and they cry. Behind the one-sided mirror, there are other residents watch that master in action, then someone else will do it, and everybody learns from each other on mistakes and on some good behaviors. Similarly, how to discuss end of life. Again, it's a video that shows the head of a department, this guy, head of the department for Hadassah, deals with a daily task that all physicians are going through, how to convince, how to check with the brother and sister what would be their preference, or in fact their mother's preferences as she is about to pass away. This is a very, very well-known discussion that takes place in hospitals daily. This is a skill. That's what we call higher competency level. It's a higher order skill. So Messer over the years have really been successful in mandating simulation. Not a nice toy to play with, not just to play with in a medical school or a nursing school where most of the world is mostly focused on, but rather taking it to the next level of higher seniors and beyond. So Israeli interns, about 2,000 of them annually would come to the Sim Center as a mandated 4 days nightmare course before they go into the internship. All ED staff, physician, nurses, security people would be trained by us on being prepared for patient experience. Many, many more examples in any given field that you can think of. But we went one step further, which I believe no other place in the world is taking that with that level of maturity of regulators. We are now testing ourselves on competency as part of licensing. And this is done with the Israeli National Institute for Testing and Evaluation, the sister body to ETS here in Princeton, the Educational Testing Services. We measure what is difficult to measure: coping under stress, teamwork, leadership, and obviously the clinical aspects of your doings. And it's done today in Israel for all Israeli anesthesiologists, all emergency medicine doctors, pediatric, adult, all paramedics, all advanced nurses. Over 3,000 nurses annually would come to us to be tested if he or she could become a psychiatric nurse, an emergency medicine nurse, a breastfeeding nurse. Show me that you can do it. Don't tell me. We know that you know the protocol, but show us. So that's the whole simple revolution of simulation, as you can think of. Even admission to medical school that Steve mentioned before is taking place at our center. So candidates to medical school, about 1,500 a year, would come to us on actors, role-playing actors. Let us check if their MCAT is in skyrocketing MCAT. They might not possess maturity, sensitivity, reflective skills. So we're really pushing the standards way beyond what has been pushed before. So a little bit of the numbers. We were founded in 2001, over 60 employees, big numbers of of trainees. Over 300,000 people have been trained by us, 20,000 annually, big numbers, the whole Israeli healthcare system. And you see all the numbers here. We're one of the largest employers of actors in the country after the National Theater. And we're very proud of it. And our actors will be Arabs, Ethiopians, old age, young age. That's where many of the mistakes take place in our communication with the other. It's not about us communicating among themselves. It's something completely different. Nationally, we've penetrated and impacted the Israeli healthcare culture vertically from admission all the way to people in my position, Eyal's position, who are the ones who would have to apologize on behalf of the medical center that we did bad and someone got the wrong blood. So that's something that we need to do that. That's not done by a medical student or an intern. Similarly, all types of health professions, all types of healthcare institutions, and many, many other aspects of Israeli educational services are being run with simulation with us as leaders. Internationally, we've been working around the world with many, many bodies that have taken us, as Eyal mentioned about ARC. We've been doing it for the last 20 years or so. Sao Paulo, Albert Einstein, New York Presbyterian, here in Manhattan took us for about 5 years to accompany them in their simulation journey. Same with Mayo Clinic, Case West in Ottawa, as well, as Eyal mentioned. And I'm very proud that here in New Jersey, Holy Name has been working with us for quite some time, and others as well, you see. But it's not only about us, the Western world, it's about the developing world as well, and we'll be working in the developing world as well. You see here recently in Bahrain, as Eyal mentioned, Kenya, and other places as well. As we look forward, we're building the state-of-the-art SIM center, as you can see here. We're going into a 7,000 square meter SIM center where we'll have the ability to do more personalized simulation, virtualization, and many other aspects, the 3D printing and the use of high-end surgical simulation in the Health Space 2030 on the 3rd floor. Again, you won't see that video, which is a beautiful video that shows the building and the internal aspect of the building, which can really demo where we're heading. The -1 floor here will be Surgical Innovation and Training Center, a global one, where people could come and train for 5 full days on a new technology that was just released, or an old technology that they're only now being trained on. This is a video that you won't see, but it will, had it been completed, you would have seen that we are now on the 2nd or 3rd floor, about to go into the 3rd floor of our construction to be opened in about a year from now. That's where it was constructed. And Messer as a whole, all 6 floors or 7 floors, would allow us to really create a site for development and validation of new medical devices or softwares, and training and implementation of new devices, both top-down at J&J level or bottom-up. There are a few ARC member companies here that would benefit from trying out their products in a SIM environment, trying them up with many, many health professionals that come through our center, and they'll get feedback before they actually release their products into the field. Again, many, many VR capabilities that are not shown here now, but practically augmented reality and virtual reality is a hub that I'm heading on behalf of Eyal at ARC, and that's another very promising field that we believe will be part of the futuristic healthcare training, and no less important, healthcare production, because augmented reality, like helmets of pilots, would become another aid of physicians in the OR, in the procedure environment. So Health Space 2030, as mentioned by Paul and others, has started to host us on pop-ups events. This is Oli and Rani from Messer and Boris with the thermal imaging technique that comes from military, obviously. And again, we won't see the video. I'm very, very unhappy with the fact that I think you mentioned, you realized it, right? I'm not really trying to hide it. But these are two webinars that one we did together with ARC on COVID, and we tried out a lot of new technologies that were offered to us, and we ran all these technologies at the SIM center so that we'll get a feel of these technologies like robots, like Vocalis let us assess a patient's respiratory condition via his or her voice. So all these ideas came up, and we tried them on at the SIM center to make sure that these companies would receive some better feedback. Similarly, with remote care, you would see here all kinds of Taito and all kinds of techniques that are now about to be already, I think, endorsed by Israeli healthcare and maybe beyond. But these are all in environments where you can actually 2030 Health Space was already tried out at our SIM center together with ARC and the companies in Israel. So as we move forward, that's the one before the last slide, I strongly believe that simulation is a very powerful transformative tool to really change paradigms along the lines of what Eyal was saying and Steve was saying and others. So we're moving away from the 20th century traditional way of doing things, of educating, of running healthcare system into the 21st century concepts, as you can see here, much more proactive, simulation-based, and certainly much more focused on structured approach to new technologies, whereas we are trying kind of to improve them, accelerate their R&D, and eventually benefit from them in the actual healthcare environment. So HealthSpace 2030 really is a vector to enhance healthcare systems in general, and certainly its accountability. So the message of Messer, when you come out of a simulation environment, the main message is humility. You realize how unprepared you are. You realize how much you need to be better prepared. And you also, as a healthcare system, you improve your accountability of the way we train and the way we move on as we move forward to future of healthcare. Thank you very much.
Thank you, Amitai. I apologize for the glitches. What you also won't see is Amitai giving me hell in the hallway afterwards. Mark Tikachinsky has the best reason for not being here. He has the best handwritten note. He's in Israel, actually. But he did send us a brief video message, so let's take a look at that.
As healthcare transformation accelerates, those who can find ways to bridge disciplines and institutions with complementary strengths will be at a distinct advantage. Thomas Jefferson University's strategy centers around creating such bridges as part of what we call a strategy of connection. And it is for this reason that we are excited about the HealthSpace 2030 initiative, a frontier where we can showcase what is possible through disciplinary bridging. At once, here we can build on collaborative successes to date between Jefferson and Sheba Medical Center in wide-ranging areas such as space medicine, clinical neurosciences, synthetic clinical data, and healthy city architecture. For HealthSpace 2030, Jefferson brings to the table its long-standing and deep strengths in architecture, industrial design, textiles, and fashion, not to mention its storied medical college and the dramatic clinical scaling over the past decade, now being one of the nation's largest academic medical centers. A coming together of the Sheba ARC Health Innovation Powerhouse with Jefferson and its complementary strengths at the Health Design Nexus will lead to major creative synergies. Doing this all in New Jersey is especially compelling for us, given Jefferson's strong health services and academic presence in the state, not to mention that I myself was born on the edge of the Pine Barrens in mid-Jersey. Together, we are positioned to make a difference in creating new healthcare paradigms for the mid-21st century.
So we have Orly Beeger as our last full speaker, then Eyal's going to wrap it up, and then we're going to be able to take questions of all the speakers. Orly Beeger is the CEO of the Liberty Arc Health Space 2030 and the head of ARC Global. She joined ARC in May 2022 as the Chief Business Officer to lead strategic partnerships and grow ARC's network of international partners, including leading medical centers, industry partners, academic institutions, government offices, and startups. Today, as I said, she's head of ARC Global, and she's leading all their initiatives, including Liberty Science here in New Jersey. Prior to Sheba, Orly worked for more than 18 years in different key roles in marketing, sales, commercial and strategy for pharmaceutical companies, including Teva, Pfizer, Janssen, J&J, and MSD. She holds an MBA in Healthcare Innovation from Reichman University, a Master's in Health Administration and Public Health from Bar Ilan, and a Bachelor's in Medicine and Science from Tel Aviv University. I give you Orly Beeger.
So, thank you all for coming. I'm super excited to be here with you and really appreciate that you come, and we have here representatives from almost all medical centers in New Jersey, and also a representative from the industry, pharma, medtech, VCs, and it will be a difficult mission to speak after those four superstars. But really, I would like to tell you what we are going to do here in Liberty Science Arc Health Space 2030, and to explain why we called you today for the first meeting, the first partner meeting. All right. Okay. So here we are, as you understood, we came from Sheba, MSR, and ARC. And with collaboration with Liberty Science Center in Sci-Tech City to create this place. And we are getting the 8th floor at Edgework. And our vision, and our vision here is to really create a state-of-the-art innovation and simulation lab to build the most advanced vision and reality of the future of health by using cutting-edge technologies and health design. And this is a sister project, as Eyal mentioned and Amitai mentioned, of a project in Israel that will be built at the 3rd floor of MSR, and it's expected to be ready sooner. They are expected to open Q2 2024, and the idea is it will be a place that all the players in the ecosystem will be able to design and develop, simulate and test, to demonstrate, and to create global impact in order to improve healthcare. And it will be a place to showcase how the future of health will look like, not something that we know from today. And the way we see it is we will have a conference room to have conferences between Israel and New Jersey and other places in the world, and also a playground for all the stakeholders to come and test technologies, to co-design together and to demonstrate. We are getting the last 8th floor with the best view, and the idea is that at the 6th and 7th floor, startup companies and VCs will sit, and a startup can work on a solution, go up 1 floor, demonstrate it, test it, get feedback from professionals from the medical center, go back to the lab, improve it, and really create good opportunities for innovation. The 1st floor will be for conferences. So here is how we plan to have a space that when you enter, we will have a control room, and then you will be able to see the operational room of the future, ER of the future, inpatient room, a clinic, also a clinic in a developing world. And to test all those technologies, we of course going to design a home room with technologies and simulate all those capabilities. So what is the timeline? On October 2029, there was a big announcement for Sci-Tech City. Since then, we signed an agreement. We started to reach out to you at the end of last year. And now we are at a point that we had the first pop-up exhibition. We are meeting here with you, and we are going to reach out soon architectural firms to design the place, to design the spaces. And then we are expecting the end of the year or beginning of next year to call for applications, to call for challenges for universities, academia, medical centers to think about solutions to different challenges, and we will have a committee that will decide about the solution. So you already heard that we had the first pop-up exhibition with thermal imaging and a VR experience. We had a call for application from Israel asking for technologies from home care, and this is the way we would like to do it also here. And here you can see all the strategic partners that we map, and we started to reach out. And really, we are going to all of them, the payers, academia, startups, providers, industry, from the pharma, from medtech, technology, and others, and VCs and accelerators, because we think that the only opportunity to drive innovation is to work with all of you in collaboration together. And we would like to suggest membership, annual membership, and we have 3 types that we defined. So you can choose between titanium, be significant partners, and to have seats at a steering committee that will decide about the strategy of the place, because no one knows today how the future of health would look like. This is why we need to sit together and discuss, and you will have the opportunity to bring a representative to the steering committee and to the expert committee that will decide which technologies will be shown. And also, you will get a chance to be a member at the FOH, Future of Health organization that Eyal mentioned. If you decide to go for the platinum, you will be able to access unlimited access to the simulation training, R&D, be exposed to different researchers, and showcase technologies, either if you are a medtech or startup company. We probably have different rates, of course, for startup companies to bring the technologies. And if you are a gold member, you will have an annual access, you will get access to newsletters and different exhibitions that we plan to do here in Liberty Science Centers. And those are more or less the rates. If it's titanium, it's 2,000 to 2,050, 250,000 K a year, or you can see here for platinum, 100,000 to 150, or 50,000 if it's an annual access for the gold. So we are calling you today to join us to create the future of health together, to be our members, to decide with us which technology will be shown, to design with us the future, and we really thank you for being here. Thank you.
Thank you, Orly. So I'd like to call up, just to tie a bow on today and pull it all together, Professor Amitai Ziv. I'm sorry, Eyal Zimlichman. I glitched, even I'm glitching now, Amitai.
So I know it's been a long afternoon, and you've heard quite a lot. So I'm going to try in 2-3 minutes really to tie it together and present the opportunity of what we're trying to do here. So you've heard about, what the problems are in healthcare. We've discussed that. We understand that we have to do things differently and to transform, which is of course critical for all of us, whether we're healthcare providers, whether we're consumers of healthcare, whether we're universities and training the future generations of healthcare professionals. So this is one angle. The other angle is that common vision we're trying to create and pull it into a global effort, which is called ARC. And this is really gaining huge amount of traction right now. And we are looking for a place that would sort of turn that abstract vision and many of those abstract opportunities into something much more tangible. And this is something that we came up with as this idea of the health space. Like everything else we do at ARC, ARC is all about partnerships and collaborations. This is not about Sheba Medical Center trying to change the world by itself, but it's about us working together to be able to do that. And we think that here in this specific environment, there's this unique opportunity to make it happen. We found the right partners here, the right people here, the right mentality, the right vision, the right chutzpah to say, yes, we're going to do it. And out of this place, which today is teaching the children that will be obviously the adults of the future and will see this unfold in their lifetime, this is where right next to this place of education and a place for science, we want to make sure that we are building the most updated vision of what the future of health needs to look like. And this is an effort. None of us can do it by themselves. We reached out to healthcare systems and universities. You each have already activities working towards that goal. But we all realize that if we pool our resources and imagination together, we will be able to create a much larger impact that would improve not just the health of the population here locally, but globally, and will have a clear impact on how we all see the future of health unfold ahead of us. And, you know, I don't have to, again, point out to the challenges that we're facing. So this is what we're suggesting. The way to do this is through what Orly described. This space will allow us to test out, first of all, innovation in design. There are design schools here in this room and others that we're looking to approach. We will have competitions for students, for faculty, to come in and try and solve a certain problem. I'll give you a very, very basic example of something we had at Sheba. We're designing a new ICU right now. We actually are launching it next month, cutting edge technology, but we were talking with many of the clinicians, and they said, well, it's a problem for us as we approach the patient who's on the bed in the middle of the room. You all have the picture in your head, to really be able to work 360 degrees around the patient, but still have access to the monitoring and all the other equipment in the room. So we had actual design students come and try and help us to solve this. Now, of course, it's not within the capability of design students to actually develop a product that will solve it, but the design principles will serve the industry in being able to change how we see ICU rooms of the future. The same goes into everything else in the hospital environment, but much more than the hospital environment, and the epicenter of the health space would be the home environment. And we all realize that everything is moving to the homes. The hospitals are moving to the homes. Wellness, aging in place. We want people to age in their homes and not leave to other environments for elderly. To be active until a very old age. This is what we all hope for ourselves and for our family members, and this is exactly what we're going to work within Liberty Science Center project here at SciTech City. How do we build a home environment with all of this in mind? How do we tap into the smart home capabilities that we're going to start seeing in the next couple of years? And then with Scholars Village, which is the 2 apartment buildings built right next to it, how do we actually implement those new ideas in the actual living space so that people can enjoy this in their lives? And there's many, many ideas that we have around that. So the convergence of all these mega trends that we see in healthcare that have to take place, and you know, Steve beautifully talked about that before, will be here in this project. And this is where we were looking forward to meeting you. We'll be very, very happy to follow up, provide much more information. Of course, there's a lot more to speak about. We couldn't do this for a couple of more hours. And of course, think together with you, because we don't have all the answers. So some of this we'll have to think together about how do we better approach this and make it more substantial so that we can create that impact we're looking to create. I don't have to say one last thing, which is this will, and we've seen this at Sheba, this is also acting as a magnet for businesses that will come here to be next to this. This is a driving force for the economy of New Jersey and the region. We'll see new jobs. We'll see companies come up and set up shop here. So this would actually play a much larger role than just healthcare, really be an engine of growth for local economy, as we've seen happen around Sheba Medical Center and some of the other locations we're working around the world. And this is exactly what we're now building in Melbourne, and part of why we were chosen to come into Melbourne and build this a new ecosystem for innovation in Melbourne. So I'll stop here. I don't know, Brian, I'll let you take the questions and we'll try to answer. Yes. Thank you.
So you have on the mantra of our age is you're on mute. So everyone in front of you, or most of you have a machine, press the button to talk into the microphone so that people can hear you online. For the folks online, if you put questions in the chat box, we will receive them and read them out. So questions, please. Someone be brave and give the first. Or I'm going to start calling on people. Just want you to know. No questions? I'm going to have to call on you. Karen? Oh, fantastic.
Thank you. Very nice to meet. I'm Karen Garouvi from Sandoz, part of Novartis. So again, the industry piece for this presentation. My question is around, I like your sentiment about we changed, we first changed and others. But we talked about equities and how do we provide more kind of access to patients. And again, as a company that provides generics, and it's all about creating access to patients, I do believe that we need also to find a way to change the system. So I understand that we're going to change the science, but how are we going to deal with the way healthcare is provided in the US to support this and actually make sure that patients will get access to this innovation?
Is that for Steve? Steve, anyone else who wants to take it?
Well, look, I think, we have a really messed up payment model here, right? I mean, I think there's an Upton Sinclair quote, it's hard to get somebody to do something when their salary depends upon them not doing it. So, I think I'd start with that first song, Courage to Change. At Jefferson, we have an orthopedic group of 179 orthopedic surgeons that don't take Medicaid. And, their answer was, they average making a couple $1 million a year. We'll take Medicaid if you pay the difference to what Medicaid and commercial insurance pays. Most other countries would say, okay, well, if that's going to be your stance, then you can't accept any money from any government agency, Medicare Advantage. Or we've sort of let everybody do what they do, which preserves the ability for doctors and hospitals to do what they do, but really ends up hurting the most underserved. So I think how you democratize some of this really gets down to how do we use technology to take things that wealthy folks can do and get it to people. So I'll give you an example of a company I'm involved with at General Catalyst called Paradigm. If you think about clinical trials, if I have pancreatic cancer and I'm seeing a community oncologist, let's say at Holy Name in North Jersey or Hackensack, and there's a phase 1 clinical trial, phase 2 clinical trial, folks with means could say, I'm going to go to Sloan Kettering to get MSK to get that. If you're seeing a community oncologist who's really just as talented, most likely, as that person, because of infrastructure and that kind of thing, often they don't have access to those phase 1 and 2 clinical trials. So what this company is doing is using blockchain tokenization and other AI things to bring all that infrastructure into the community. The ability to have everybody get the same clinical trial that you'd be able to get if you went to MSK or you went to Jefferson. So to me, some of this is one of the companies I worked at out of Israel is doing remote obstetric monitoring. My daughter got pregnant during the pandemic, and she said, Dad, I had to spend $35 to park. You're okay. I thought you were the digital dude. Like, can't you take care of that? Well, the fact is that it was a pain for Jill. But again, somebody that couldn't access that. So you say, well, why don't we have that? Well, there are companies that do that. In fact, there's a company out of Israel called Nuvo that's being pioneered and partnered at Sheba that's doing remote obstetric monitoring. So why isn't it here? Well, it's not here for a couple reasons. One is we get paid for having people come to our hospital, right? So literally that's what the payment system is, by and large. We talk about value-based care. Value-based care in 2023 is a myth. I mean, I talked to probably 100 CEOs and a year and I'll go, so how many of you have, more than 20% of your of your revenue based on value-based care, and there might be a handful of hands coming out. But the other issue is, and again, it's not the only issue, but even malpractice. Philadelphia, there are like a couple malpractice attorneys for every doctor. So the first baby that was born from using Nuvo at-home obstetric monitoring, that 15 years later didn't get into Princeton, you know, you'd have seen these commercials at 2 o'clock in the morning. Did your baby not get into Princeton? Did you use Nuvo monitoring? Call, you know, Schwartz and O'Reilly, and we'll. So I think we have a system that brings a lot of dollars to every piece of that system. I think you folks at Novartis, I mean, I think I called you out on the thing, have really, you know, started to say, how can we not just use our drugs to get out? That cardiovascular thing that we did really started with that cholesterol-lowering drug that you guys are developing that's like a once-a-year drug. But the key was, how do we get the word out to people at home? So I guess the answer is, how do we start to literally look at what we've known for a long time, that 80% of a person's health is what we spend about 10 or 20% on. And I think where we're starting to see that happen is where there's an alignment between the payers and providers. At Jefferson, we sold 50% of our ACO to Humana. So we now have Humana, Jefferson, and Mainline Health, all totally aligned. We acquired a Medicaid and Medicare Advantage plan called Health Partners Plan. Now here's where that changes everything and gets to your point. So now that we own Health Partners, or we own Health Partners Plan, we had a patient that come in 15 times for exacerbations of asthma, a Medicaid patient, costing us a lot of dollars, costing her a lot. Turns out, when you bring a community health worker out to her house, she had a lot of mold. That's not usually what hospitals say, well, I'll go fix your mold. But now that we own this Medicaid and Medicare Advantage plan, that's exactly what we did. So the concept of really starting with getting away, as Eyal said, getting away from the technology, but starting to talk at healthcare at any address, and as I said in the video, defining a place like Jefferson or Hackensack as, you know, we're your partner, starting at home, I think is what will start to make the difference. But it's going to require some kind of payer-provider alignment that's starting to happen, but until that happens, it's going to be very difficult.
Thank you. A question, sir. Yes. Speak into your, you can speak into this.
Okay.
I'll just run.
That'd be great. So I'm Rob Brenner from Valley Health System.
Thank you for identifying yourself.
And one of the things I'm very inspired by today, this has been phenomenal, but I look at some of the challenges that we have with innovation. One of them being that we're in a fiercely capitalistic society. And what that does is create competition. And out of competition comes some good things. But innovation requires that all sectors of the healthcare, whoever can put something forward for healthcare, to come together. So how do you get beyond that competition to make sure that we have pure innovation? And it's really a challenge, sometimes.
Yeah, well, you know, for ARC, and you've seen, you know, the magnitude of the partnerships, you know, competition is driving a lot. You know, some tell us, you know, you guys work with a few pharma companies, or, you know, how can you guys work with a couple of centers in Chicago? You know, there's huge competition between them. The bottom line is that there's so much need in the market that we can all focus on something different and all still work with each other. You know, if competition is an issue. And that's why we work with multiple pharma companies and we do something with each one. I have to tell you, we almost never ran into any issues with that. You know, with one pharma company, we're focusing on treatment for asthma, with another one, diabetes, with a third with ischemic heart disease or neurological. Again, because the need is so large, we can definitely pinpoint what we're doing if there is any issue of not working together. But what we found out, and you know, you should come to the ARC Summit and see it for yourself, what we found out, and this is an actual example, is I was going around the tables where we had meetings in Tel Aviv, and I was seeing one table and there was Northwestern. It's easy for me to talk about Chicago because they're not in the room. I could have said the same about New York. But it's Northwestern and UChicago sitting around the table starting to talk about a joint a joint project they want to do together. And then somebody took me to the side and said, you see that? That would never have happened unless you guys would have provided the right opportunity for this to happen. This is exactly what we're trying to build here. We're trying to build that opportunity, and believe me, we will be able to take away many of those challenges. And I can give you a lot of examples of that. We're meeting tomorrow, so I'll follow up.
And the brilliance of the Chicago thing is, if it was Mayo Clinic doing that, Northwestern Chicago said, we don't want them here, we're better than them. The Sheba is the perfect piece because it's not competitive, but they can look at the Newsweek top 10 and say, oh, wow, I can really respect them, but I'm not worried about them. So yeah, bring them in. It's almost the perfect mixture for large health systems in urban areas to basically say, hey, you know, I'll partner with them.
Two excellent questions. The bar's been set high. Yes, sir. Can you speak? All right. I need to lose weight.
Sorry for running. Hi, I'm Nadav Shimoni. I'm from Arkin. I'm managing the Digital Health Fund within the organization. Arkin is a $2 billion healthcare and life science investment group located in Israel. First of all, thank you for having this great event and terrific discussion. I want to follow Dr. Klasko's comments to some extent, and I was just wondering, creating simulation for a medical device seems pretty straightforward. And I think there are many great inventions coming from Israel in that frontier. But with software, all the elements of payments in the system, all the financial elements sometimes are really, really crucial and hinder the efforts of companies to move from Israel to the global market to some extent. You look at companies like AIDoc, they are very clinical, but you don't see a lot of companies that are actually targeting the intersection between payers and providers that Dr. Klasko mentioned. So, for example, we have Minel here with Abacus and, you know, working on the very core issues payers are having, and I don't see many Israeli companies trying to do that. So I guess the question I'm trying to ask is, do you consider within this center to create simulations to emulate any financial elements, any things that might be relevant to payers, that might sit in this crossroads between payers and providers?
We feel uncomfortable for you running around, Brian. People can use their microphones, but it's a great question. First of all, you know, I mentioned before, it is what we're going to make it, right? I mean, if we bring the right partners in, we also want payers to be here, right? And Blue Cross Blue Shield is already a partner in Liberty Science Center. Then we will run pilots on new financial models, on new payment models. This is exactly where we want to take this because we realize that this would have an impact. I want to very briefly just touch on two examples we've had at Sheba where we did this, and there's no reason why it shouldn't happen here. One was, they're both in the telemedicine space. One was with telecardiac rehabilitation. You know, some of you know cardiac rehabilitation is a problem. We don't have enough beds. We're doing most cardiac rehabilitation inpatient, and we don't have enough beds for everyone. And so what we did at Sheba is we piloted telecardiac rehabilitation, which is completely at home. So after you're going through acute myocardial infarction, a heart attack, or cardiac surgery, you're receiving at home the full cardiac rehabilitation program. We've shown that it is at least as good as doing it inpatient. And we've taken that evidence to the to the Israeli Ministry of Health. And through the Israeli Ministry of Health, they decided to have a code that we would be paid for doing cardiac rehabilitation remotely, not just in hospital. So creating the evidence and then going to the payers and then having pilots where we can study this. This is what we did there, and no reason why we shouldn't be doing this here. And another thing we've done with psychiatric home hospitalization, and Amitai manages also the psychiatric hospital at Sheba. We've done psychiatric hospital at home, where patients are doing their entire hospitalization. These are acute psychiatric patients. We all know how difficult they are. They need typically at the hospital, but they can be managed also at home. We did this, but we did a bundled payment model with the HMO, so that we were paid for this for the hospitalization, but we took the risk for a full year post-discharge. So if a patient bounced back, we weren't paid for it. So we took the risk on those readmissions. We lost money on the first year. We pretty much broke even on the second, and and we're making money on the third. So this is exactly the type of work we would like to do here. It depends on who the partners would be. Can we bring the meaningful partners like the payers on board and then run these pilot tests with them to then scale them larger than that?
Just to elaborate a little bit about what Eyal said, I mean, you can easily simulate and come with proofs of concept on the financial aspect as well, Nadav. Because, for example, Eyal just mentioned the psychiatric hospitalization. We started with one HMO, now 3 HMOs are working with us. It's a win-win. They can't do those psychiatric patients who are insured by them. They're way behind in terms of their ability to serve them. So we offer that. Now it's going into psychogeriatrics, where you don't really want the geriatric patient to come over to the hospital with his or her psychogeriatric. It's now part of women's psychiatric issues that relate to perinatal, depression after birth. So they would much prefer to stay at home with their newborn rather than to come to a hospital with a psychotic attack. So we're going there, and financially it's a win-win, and it was proven early on with the simulation environment. One more example has to do with showing productivity and cost effectiveness via simulation. We now have a project where we use HoloLens to actually improve AR, augmented reality, accuracy of inserting a stimulator into the sacral environment to improve control of the anal insufficiency. A Medtronic device which is inserted into the right hole in the sacrum. Until now, that was done via trial and error. The poor patient was needled about 5, 10, 20 times occasionally until, with a lot of radiation, until the surgeon found the right place to put in the stimulator by Medtronic. It took about an hour, huge radiation. By the end of it, most of the cases were done well. Now we're doing it with HoloLens. We take the actual patient's CT angio, or CT. We overlay the CT of that very patient on the spine or the sacral environment. And with the HoloLens, you go straight into the hole, 1 or 2 punctures and you're there. Takes about 20 minutes, hardly any radiation. Productivity is doubled 3-folds, and it's good for everyone. And it's about to be published. One paper was published, another one will be published soon. So if you work along those themes of productivity, cost effectiveness, HMOs could be convinced. Eyal gave one example. We have quite a few examples that went all the way to Ministry of Health to give us a code. Telemedicine, the last example, telemedicine has been accelerated in the COVID days. Telemedicine is not just putting on a Zoom. That's a technical issue. To do psychiatric service via the screen is a higher order skill. So we went to the Ministry of Health. We offered at the SIM Center a 3-hour workshop of working with telemedicine on psychiatric patients. And it's done now as a mandatory component of every doctor, nurse, or psychologist who are doing telepsychiatry. They are well trained on that to realize that perhaps the patient is suicidal. Perhaps we need to bring the patient back to the hospital, et cetera, et cetera. So these are things that HMOs really respect. And these are the type of simulation that we can do, and we're already doing that.
Excellent. Other questions? And keep in mind, please, thank you so much. And people watching the live stream, you can put your questions in the chat box. Please, sir.
My name is Manal Patel. I'm the CEO of Abacus Insights. As Nadav said, we focus on the payer side of data integration. I'm also a general internist and spent the last 20 years both as a practicing physician and a payer. Actually, David Bates is a mentor and friend of mine from the Brigham, where I trained. Most importantly, I grew up in Jersey City, so this is my hometown, and I serve as a trustee at Liberty Science Center. So a lot of great conversation today. And one of the questions that I have, and actually would welcome all of you to comment on this, is the trust factor, right? And I think we talked a little bit about the abrasion between those that fund healthcare, those that consume healthcare, those that deliver healthcare, the innovations in pharmaceuticals. The trust factor is a real barrier, right? When we talk about payer-provider collaboration specifically, sharing of data becomes a real argument about what data do you need because of the transparency issues of clinical care versus payment. How do you think as a group we should focus on that specific issue? Because candidly, all the technology in the world won't solve the fact that the collaborators around the table, they don't trust each other, we won't really get anywhere. So really welcome your comments on that.
So look, I think, everybody talks about data, right? The fact is that there's 3 or 4 problems with data. One is how secure is it? And I think it's even a bigger issue as we start to think about genomic data, right? If Google gets your sodium level today, who cares? If Google gets your genomic data, that's you. Of where it worked. We did a partnership with a company called Color Genomics, where we offered every one of our 35,000 employees at Jefferson full CLIA testing, genomic testing. Why? Because we talked about payer-provider alignment. I think one of the things, at least in the United States, that people don't recognize enough is the amazing opportunity in TPAs of large health systems. Right? I remember I was on a panel with the head of Amazon Care, and I asked her, like, what's the one mistake you made? He said, well, we were going to go in and put billboards that, Amazon Care can come to the largest employer in your city, and we can undercut the hospitals. Then we said, damn, in most major cities, the hospitals are the major employers. That's probably not going to work, right? So the issue so we went to Color, and we offered that to all 35,000 employees. Why did we do that for free? Because literally, I'm their payer, I'm their provider, and their employer. It's totally aligned. But here's what we did, and we wrote this up for the Wall Street Journal, because it was right when Google and Ascension were doing their thing, and that became a disaster, and Google was going, hey, we're this cool company, why don't people trust us? Lots of reasons for that over a drink. But we said, look, here's what we're going to do. You'll get the CLIA testing. We won't even share it with your doctor unless you want to share it. And then next, if you want to share it with your doctor, that's great. We will share it with your doctor. And then the next question we'll ask you is, do you want to share it with Novartis using MD clone technology, or do you not? But at every point, the patient had the ability to decide, first, do they want to get this done? Secondly, do they want to just come to them? They had a confidential thing with a genetic counselor that really was totally outside. And we saved lives. I mean, there was a woman that turned out that she has this rare genetic disorder that significant exercise and that's why her dad died at age 50 or whatever. Turns out she was going to run a marathon. Turns out we genetically tested her son, and he had it also. What was fascinating about that, by the way, there was almost an inverse relationship in trust between where a patient was salary-wise in our thing. So the people making $17, $20, $30 an hour said, thank you, President Glasgow. This is just such a great perk. We understand the trust. I used it for my family. Thank you. The faculty, the chair said, you're going to use this for my tenure, for my, and I was stuck with, trust me, I'm your president, and that didn't go very far. So the issue of starting to literally create companies that are looking at data and starting with trust, and I'll give you an example of a company at General Catalyst that we've started to look at. It'll be a public benefit corporation. Right now we're calling it HealthX, that will use blockchain tokenization and DAO, that will basically go to patients and say, you are the owner of this data. If you choose to share this, and we'll go to payers and we'll go to providers, choose shares, it'll be in a big repository. We have some pretty cool AI to look at it. We'll then go through all the epic charts and say, we're looking for 20 people with high rheumatoid factors between the ages of 60 to 70. Right? So instead of having to put an ad in the paper, literally we'll be able to find those. And by the way, then we'll go to you and say, you were identified. Let me explain everything about this. Do you want to be part of this? Your data is in the repository. If you say yes, you will actually get something for it, whether it's cryptocurrency or whatever. It's very similar. My son's an actor, and he was on an AT&T commercial. Every time it gets aired, he has a little app that says, this just got aired. You will get X. So the concept of getting over the whole we own your data or trust big tech. The patient owns her data. She can decide, I want to use it. Is it really secure? We have to make sure it really is. There's some, MD Clone is a company that came out of Sheba, which is probably the top de-identification company in the world. How do we bring the de-identification companies together with the folks that are using AI, et cetera? I believe that that's what will start to change. What's not changing is, and it gets back to the question that was asked before, is the whole transparency issue. And that gets back to the capitalism issue, and that's not a good story. When they created the transparency things where you have to put all your charges, and what you're actually getting paid for different things, all that did was spawn consulting companies that were basically going to health systems and saying, here's how you can officially put it up there so you don't get fined without really being transparent. So the issue is, that was one of the very few things that both the insurers and the health systems agreed on. We don't really want to be that transparent, right? So I think that, that's sort of the part that I don't have an answer to. But I think you'll start to see some really exciting, secure data repositories that aren't owned by a for-profit. In this case, it'll be a public benefit corporation. We're starting to see some others. Graphite is an example of that came out of Intermountain Health. They had done that with generic drugs, that it was owned by the health systems that are doing a similar thing with data. So I think that's an optimistic message.
Thank you, Steve. Yes, sir. See if your machine works. Oh, great. Go for it.
I get it? All right, good stuff. Name's John Gordon, general partner at HC9 Ventures, early stage healthcare software and services fund, but spent 10 years at New York Presbyterian Hospital, first in strategy, and then running their corporate venture fund. So this kind of feels like a homecoming hospital-focused meeting, so I appreciate the opportunity to be here. One of the things we've spent a lot of time looking at as a fund is digital therapeutics, digital interventions. And even going back to my time at NYP, it's clear they show enormous promise for all kinds of applications. But as an investor, I look at those and I look around and say, how are these going to get paid for? And to see someone like take a Paratherapeutics, and I'm not picking on them in particular, but just anyone come in and say, okay, well, here's an app and we want to charge you $1,500 a month for it. We're like, okay, but I can go get something else on the App Store for $4.99 or something like that. And what we're trying to figure out is how do you, there's a future, maybe it's 2032, where all of these things are readily being used and readily being applied. But how do we get from here to there in two ways? One is convincing clinicians that these are as effective as the things that they can poke and touch and ask someone to swallow. And then the second part is, how do we get to a payment system? Because right now, basically everyone's trying to come at this and say, well, we're going to come at this the same way we've done everything else, which is charge a ridiculous amount of money for it. And I recognize that my peers are, in part responsible for some of this. But how do you get to a payment system that encourages the adoption and bridges that gap to the adoption of these solutions? Because I haven't figured it out yet, so I'm hoping someone else here has.
So this might be a question to anybody in the room, right? I mean, obviously, a great question, I'm trying to answer in a sense of what we're trying to do here. How can that play a role in what you're talking about as a challenge? I think there are a couple of things that we've shown at ARC, and it goes back to some of the examples we've just provided a few minutes ago that are relevant for this. One is we need to think globally. Because some countries are moving faster on some domains, and we can learn from their experience. Germany, for example, is not such an advanced country in terms of innovation and healthcare industry is not very digital, but they did come up with a couple of new legislations now regarding apps and how do you actually regulate apps in the German market, which I think is ahead of the world. Okay, so we have learning a lot from our friends in Germany. We have a couple of strong ARC partners, whether it's Charité, Essen, and others in Germany that we're working with to see what they're doing and can we pick up from that. So again, a global perspective helps you see what others are doing ahead of the curve. The other thing is demonstration. You know, unfortunately, we don't open the New England Journal of Medicine and see too many publications about the, you know, the evidence that digital health is actually providing, you know, improved quality, improved patient safety, and lower cost. You know, I'm mentioning it today, but because last night the New England Journal of Medicine did publish something on artificial intelligence, so maybe not the best day to bring it as an example. But I think we all realize we're not seeing enough emphasis, you know, as we're seeing on the pharma company. There are pharma companies here. When there's a drug, the regulation is very clear. You know, there are issues with that as well, but the regulation is very clear. We know what evidence needs to look like. You know, there's phase 1, phase 2, phase 3. That all has been very well worked out with devices. I think also, of course, we can always improve on what's currently existing, but we are not seeing this on digital yet. And we are going to see it. And part of what we're going to be doing here is having, you know, this consortium of industry, providers, payers come together and say, this is where we're going to create the proof of concept. Starting with a lab at EdgeWorks on the top floor, that was just described, but then going out to the systems here. Because, you know, we don't want it to stay in the lab, obviously. The idea is to have this being implemented, just like health equity in South Chicago we're doing right now, and I can give you some examples of that, but how do we implement that here locally, in the local community, to improve the care for our population, create the evidence, and then take that forward towards regulation and legislation that obviously will have to happen between now and 2032. And again, being part of a global ecosystem and seeing what's going on in Israel with some of the examples we provided, seeing what's going on in Germany, in the UK, in Australia, this is part of the learning we have to do. And I think we're lacking on that. I'll just mention one last thing. FOH, our think tank, is that global nature of having 15 different countries come to the table together to discuss the future of health, having people describe their experience. It's the only body of its kind in the world. Some of you might be familiar with Health Evolution here in the US, which is an US-only institution. It will not receive members from outside of the US. I think this is missing an opportunity that you know, having this global community can provide.
So I think there's some optimism happening in this area, and I think that some of it is sort of these interesting collaborations around what will become black swans in helping this. So at the Consumer Electronics Show, I had a chance to interview Stefan Bancel, the CEO of Moderna, and you know they've now partnered with Merck around sort of two different things that are going in opposite directions that will actually now create a cancer vaccine, or at least the trials around a cancer vaccine. We're seeing some real innovation, believe it or not, in federal regulation. As Al knows, because we've gotten them involved with Sheba, I'm helping to lead a initiative around bioprinting for transplants. So Martine Rothblatt, who was Martin Rothblatt when he founded SiriusXM and sold SiriusXM, became Martine Rothblatt and started United Therapeutics, is partnering with the largest 3D printing company in the world called 3D Systems, DDD. And we literally will have a bioprinted breast ready for clinical trials. So after breast cancer, instead of having to use saline or silicone, you literally will have, you know, a breast that will be, frankly, much less complications. My wife had breast cancer, and the surgery went great, but she's on her 3rd revision. We're sort of stuck in the 90s in that. But more importantly, we'll have a pig living in a bioprinted lung. And the reason I'm bringing that up is we've now gotten an advisory board together of the former Secretary for HHS, the former Secretary of the FDA, et cetera, that are working with the federal government to get ready for these things that don't exist today. The third piece is going to be that whole sensor technology and nanotechnology that's sort of going through your body and sending those continuous signals, and what do we do with that? So I think what I'm excited about is we are starting to have some collaborations and have CMMI and the government sort of start to think about this. As it relates to global stuff, I couldn't agree with you more, you know, and this gets into a little bit of simulation. Think about this. Healthcare is the only industry in the world where you could be like, if you're the CEO of the, Australian National Bank or the Shanghai Bank and you want to come into finance in the United States, yeah, we'd love to have you come. If you're the chair of cardiothoracic surgery in the best hospital in Australia or the best hospital in Israel, Sheba, and you want to go and move to the United States, you have to pretty much retake your residency. So, and not only that, but the way that treatment occurs, we assume that the only treatment that makes sense is drugs and surgery that were developed in the United States. I was in India for 2 weeks. I hurt my back, and I wanted a Flexeril and a Motrin. And I went to the academic medical center emergency room, and I said, great, yeah, we can take care of that. We'll do acupuncture and Ayurvedic medicine. And I said, I want a Flexeril and a Motrin. They said, we have to go to this weird alley over here where there's an American drug doctor that gives drugs and does surgery, but like you should really try and So I mean, I think part of this is really starting to do this. As my colleagues from Jefferson know, Bernie Marcus, who is a founder of Home Depot, gave us $100 million to create the Marcus Center for Integrative Health because we were creative enough to say we're willing to look at how traditional American medicine can work with Asian medicine, et cetera, and integrative health in a very, very different way. So I have some optimism that will start to happen and that we'll start to see some of those partnerships.
I want to go with this optimistic spirit. I think all of us are very optimistic. I think that's why we're in this innovative environment. Otherwise, we wouldn't have pushed this concept. Two aspects of optimism. One is regards to trust. I think one of the lessons we learned via the simulation activities that we've done, a lot of the failures have to do with the way we empower our patients. Our patients are not empowered enough. As a pediatrician, I can tell you mothers have stopped me from doing my errors again and again because they were empowered mothers taking care of the kids. Today, if you know the Swiss cheese model, we all know that the last chance of blocking an arrow of error to eat the patient is usually maybe a pharmacist who would stop the wrong prescription, but usually it's the actual patient himself or herself. And that's something that we've taken very seriously at our SIM Center, and one of the higher order skills that we are testing nurses, physicians, and others, is how do they actually empower the patients to be members of the team. And as society kind of grows, not so much the underprivileged, but we'll have to go there as well, I think patients know more about medicine than 20 years ago. They are really much more knowledgeable. Professor Google helps them, maybe wrongly, but they're there. And and we need to make them trust us because now they're empowered with the information. Two other aspects. One is the living lab that Eyal was talking about. The living lab that we'll put here at the Liberty Science Center is not only about trying out digital software at the SIM Center here. It's about trying them out immediately after in the neighborhoods of the underprivileged neighborhoods around Liberty Science Center. Because it's about implementation of those applications right with patients that may not understand apps and may need to be well trained. So when you look at why technologies are being deserted and put aside, usually we'll say that the technology wasn't good enough. But that's not true. 70% of the technology that are being put aside, deserted, are technology that we did very bad in terms of our implementing means. Did we actually train ourselves as health professionals to actually use that? Did we actually train ourselves in the simulated environment on how to really teach a patient, underprivileged patient, to use it? And this is one of the things that we'll do at the SIM Center here and back in Israel. We'll try out the technologies, not just high-end users will give us feedback. That's not important. We'll go for the lower-end users. We'll make sure that the technology is more friendly than it is today. We'll make sure that the technology is ready to go out to the neighborhoods around here. And we'll check out the ability of patients to deal with their diabetes with A1C, all the applications that are out there. That now we're working, by the way, with Emirates. We are serving telemedicine diabetes with some populations in the Emirates and other places. We're doing it from Sheba into the periphery of Israel in the north and in the south. So these are all done with being very conscious about who is it that is using it on the healthcare side, on the patient safety, on the patient side. We're doing it a lot with rehabilitation, as Eyal mentioned on cardiac rehabilitation. We're doing it in any given field of rehabilitation. We make sure that the patients can actually use those apps for rehab, and then they're being used. So this is part of the concept of Health-Based 2030, to make sure that it's not only the technology, but it's the way we implement it.
Thank you. We are going to end on time in 10 minutes. Before I go to the next question, just very briefly, because that was a free lunch. I wouldn't be a good fundraiser if I didn't mention that we're raising $8.5 million to build out the space. Naming opportunities are available. So for those of you watching on live stream or anyone in the room, please see us afterwards if you're interested. Next question.
I'm Sonia Kleiner, RJ, and I'm from Holy Name Medical Center here in New Jersey. I'm after the Sim Center, so I wasn't part of that. And my background is mostly in clinical research infrastructure in general, mostly at large academic medical centers, and I've now worked at some community hospitals trying to help them operationalize and build clinical research. And I've been working closely with Orly and Karen, and I replaced Ravit, which I think you know. And since I've been at Holy Name, just about a year now, one of the things that seems to be so difficult for us is, great, amazing concepts, technology, innovation that's so needed. And the stopgap is something like a regulatory thing that hasn't been considered in translation from what might be allowed in another country and what's allowed here. And coming from clinical or research in general, anyone else who's involved with that, it's highly regulated, as we know. And I always call it sort of the jets and the turtles. Like the innovation once is the jets, and the federal government is lacking behind. So one of the things I really wanted to find out is, in part of this, is there a thought in building that bridge? Do you want it to be from the institutions you're working with? For example, I come from I came from Mount Sinai before this, so they have major resources to put behind. They might even have chief innovation officers and dedicated, funded and dedicated positions and resources to do this. At Holy Name, we don't have that. You're looking at me wearing like 5 different hats. So I'm just wondering, has there been thought put into, is that something that's going to come from your end? And you're going to provide that sort of bridge to understand and translate what those different requirements are, regulatory issues, et cetera? Or are you expecting it from the institutions that you're partnering with?
I think this is a critical question for ARC, right? As Holy Name is an ARC member, and we've been working for the past year or so on trying to find those technologies that we can bring in. I'll say that at least the Israeli companies, and we know this, many in the room know them very well, the Israeli companies, all of them are aiming towards the US market. You will not find an Israeli startup company that is building a product for the Israeli market. The Israeli market is just too small. They're all building it for the US market, so they all need to stand to regulation, whether they're pharma, device, or digital. They all have to stand to regulations. They understand that, and this is a critical issue. We're working with them to try and help them, much like the venture capitals here, and we have some in the room, are helping those companies. Obviously, without regulation, they won't be able to make money in the US. First sight, when a new company comes in with a new technology, a first sight is always a challenge. Some hospitals and medical systems are more well equipped to be that test bed, and some others are less. But not everything has to be a first sight. Sometimes a second sight, sometimes a third sight is also something where somebody else has worked out the kinks and the problems of regulation, and we can be a second sight. So I think there's a lot of opportunities, but basically everybody's aligned. It's not that, it's not a good fit, let's forget about this technology. The technology will have to adapt and make sure it's ready to be integrated into the US healthcare system. And we hope that through ARC this is a little bit easier, but of course regulation is never easy. This is the kind of work that we're also doing. I think HealthSpace specifically will play a role in also being able to bring regulation into this. So we would want to have regulatory experts be a part of the environment, being able to provide feedback for the new technology. Some of it will be coming from large industry. They don't need our help. They know how to handle regulation better than we do. But for the small companies with extremely interesting, game-changing technologies, there would be an environment around that will help them facilitate this through regulation and other challenges.
One more question? Sure. Well, you had a good question before, so you earned it.
Yeah, thanks. And I'm sorry for taking up 2 spots. But I was just at a national conference, healthcare conference, and we were sitting around with a bunch of CEOs. And what came up was the biggest issue among all of the CEOs of healthcare systems was really that there's a mismatch between demand of our patients and the capacity to handle patients. And the biggest conversation was around what technologies can we use to improve efficiencies, to improve access, and to improve the healthcare overall. And to answer the question about how do you get something paid for, I think that the most adaptable technology or innovation is going to be in that space, in the space of access. I mean, in the US right now, that's an enormous problem. Every health system is suffering with how do we get these patients in? People are waiting and waiting. I mean, forget about the staffing issue, it's beyond that. So that was just my comment.
Thank you for that. If you want to, by the way, come and see the secret sauce for yourself, we are taking a mission to Israel May 28th to June 5th for Israel's 75th birthday and Sheba's 75th birthday. Donors of $5,000 or more to our 501c3 get the land portion of the mission for free. They just have to take care of their airfare. So think about joining us in Israel. And I want to thank everyone who joined the live stream. Thank you very much.